Good morning.
Good morning.
Good morning, everybody.
Hello.
We're here again.
Morning,
I feel like in one episode,
everybody.
the little boy is parking upside down.
The boys parking upside down.
Good morning, everybody. Good morning. I'd like to welcome everybody to Appropriations Committee, Subcommittee, Elementary and Secondary Education. Presentation was agencies.
I'd like to welcome.
Are we taping?
Yes, I think the recording started.
Yes, ma'am. I started the recording.
Okay, thank you. Thank you. And I will ask any of my members if they have anything to say. Well, no, I guess not. First on the dock, we have the Teachers Retirement Board, and we have her over Zoom. Good morning, Helen.
Good morning.
How are you?
I'm doing very well. How's everybody doing today?
Great, great. It's Thursday. One more day this week. That's amazing.
Mhm.
So do you have any introductory statements, or do you just want to go right into any questions?
For introductory statements, I just wanted to thank everyone for the funding of the pension. And I know that there are going to be several questions, probably about the Medicare programs that we offer and some of the changes with CMS and the impact that it's having on our retirees. So I'm happy to open it up for questions regarding that and the other questions regarding the budget questions from Rep Nuccio. So we're open to take questions.
Okay. Well, if you'd like, well, we can go right to the questions because we don't have a lot of time. I just want to quickly ask on the deficiency this year. You have a deficiency of what's your deficiency? I just saw it. I thought I saw teacher. Here we go. $8.1 million. Can you just give us a brief answer of what represents in that?
Sure. Bob, do you want to take that one?
Yeah, that relates to the
Wait,
increase.
Bob.
Oh, I'm sorry. Bob Ribeiro is our fiscal manager at TRB.
Introduce yourself, Bob, please.
How you doing? Bob Rivera, Fiscal Manager, Teachers Retirement Board.
Excellent. Go right ahead, sir.
The deficit relates to the increase in the insurance premiums for the year that wasn't budgeted due to the Medicare stuff that significantly increased our rates.
So the 8.1 is totally about the teacher's pension, correct? I mean, healthcare, correct? Yes?
Yes.
Okay. Thank you. Questions, Senator Austin.
Thank you. I'm not certain if Representative Walker asked this question, but we changed the reimbursement down from a third to a quarter now. Do you know how that came about?
That was a proposal by OPM, Senator Austin, because the fund is doing so well, and we were able to, when we moved to United Healthcare in 2022, we were able to save money and those contributions decreased. So because there's a balance in the fund, OPM would like to do that for the next 2 fiscal years. I know that it's been a concern with our teachers and our retirees because of past experience.
So Helen, I'm confused by that. Are you telling me that the effect of that change is not going to affect the individual teachers, that you're still going to cover that third? What we're going to pay
Yeah.
from the state is a quarter, but
Mhm.
you are effectively going to cover a third. So it's not an increase in payment from individuals. Is that what you're telling me?
Yes, absolutely. The fund is going to absorb that differential for budget 26, 27. That is what is being proposed by OPM.
And can you send that to us so that we can have that in writing on what the dollar amounts would be on that so that we can share that with, because that is not the understanding of the individual teachers. And we'd probably have to put that in writing in the budget that would happen. Otherwise, our fear is that that's not going to be the actual impact. If you
We
know,
don't have, yes, we don't have the impact yet because we don't have the rates for 26 and 27. The concern, Senator Walker, Senator Austin, is the deficiency that
the two of us look a lot alike. We
I
totally understand it when people confuse the two of us.
I get really nervous. I said to Sue, I'm like, I get so nervous. Usually I present well. Ask me about retirees, I'm great. So the concern is the past history from 2010 to 2018. The fund didn't get funded. We almost went bankrupt. We had to switch to the Medicare plan the middle of July. So we understand the impact and the fear of the teachers. The market is volatile right now with the Inflation Reduction Act and everything that's taking place. So there's so many uncertainties. Everybody has this air of caution. And I think it's the past history that has everyone alarmed. Looking at it right now, we estimated it to be 12 million. Like if all things remain the same, it would be 12 to 13 million dollars for 26 and 27. We don't know what is happening in 26 and 27 yet. So I don't have a definitive amount or a specific dollar impact because we don't have those rates for the 26 and 27 budget years.
Because quite frankly, I'm also worried about this. I'm
Mhm.
not of the mindset to increase costs when we have a commitment to cover a third of the cost, and we actually just got there in the last couple of years. So I really need to see some more data on this particular issue
Sure.
to make sure that if we consider anything like this, that it be caveated with the fact that if the rates that you get in are so high that you can only cover a quarter and the rest would not be covered, then I really I would want to caveat it that the fund has to cover up to a third. So it's something that I think is important to do. The other thing is we've been trying to fix TRB for a long time. I think you guys have done great work on bringing us statutory changes that need to be done, and we will have some more statutory changes. And one of those statutory changes has to do with who is covered under TRB. And there is an organization, CAS, that comes from teachers' retirement. And they write curriculum for the schools and other things. And what we're trying to do is figure out the folks that we really need in CAS are minority-based people, and they're not interested in going over to CAS if they're not covered by TRB. And so that's something that I'd like to understand. Under current law, does that group, there's a bill in on this too. Under current law, does that get covered right now? Would they be able to smoothly transition and still keep their TRB benefits?
Senator Austin, I don't know. I don't know what the acronym CAS means. Are you referring to CIAC?
No, I'm not referring to CIAC. CIAC is different.
Yes.
I'm referring just to CAS. It is, Mike, tell me again what it stands for. Connecticut Association of Schools, not the CIAC, which is another discussion, which we haven't had yet either, but Connecticut, there's so many acronyms out there.
Yes,
You can
yes.
tell me what it is, Mike. But there's a bill in on that, and I'd like you to look at that bill. And they tend to work on curriculum and other things along those lines. CIAC is sports officials.
Yes.
Another area where we should be looking, because we really need to make sure that we're not putting barriers up for people that we want to get involved in other school-related issues. But I'd like to get TRB's position on both of those,
Mhm.
both CIAC and CAS, to see whether they fit in under the TRB plan, so that we can look at addressing the issues relative to both of those that are coming out of TRB. So that's not like it seems to me that they make sense, but I just think we really need to have you and your legal staff look at it and make sure that we're not making a further complication down the road where somebody is going to try to take it out again. So I'd like to understand that.
Sure. We have met with CIAC, our legal team, several times. They're a nonprofit organization. They are
Yep.
not a governmental entity, Senator Austin. And we have been working very hard for the past several years to get those non-governmental entities who should not be eligible in TRB. I do have some data. We have met with our legal counsel, Robinson and Cole, several times. So I'm happy to share that with you. The Connecticut Association of Schools, I did research that and I will check that again. It seemed to have some correlation with the CIAC, so we will revisit that. So
They're
and
not
get you.
connected at all. They're two different entities doing
Okay.
different things. So they're not connected. Send us what you have on CIAC, and
Yep.
then on the on CAS, look into that one and let us know there. And then again, double check your language that you have for having the state only cover a quarter of the cost of
Mhm.
teachers, healthcare, and let's see what we can do, what we can look at. Those are the things that I have questions on. Are there any other questions for the Teachers Retirement Board? Senator McCrory.
Yeah, I just want to piggyback on what my colleague said in regards to CAS. Many of those individuals who are working for CAS now were teachers and or administrators, and they were already participating in TRB. So I don't understand why it's such a heavy lift to have them continue to be a part of TRB when they already invested years and years and years providing funds to TRB because they were in their school systems as educators, as administrators. So I can't understand why that'd be a heavy lift. I wish you take a double down on that, at least for CAS. CIAC, that's another conversation, but CAS, we need individuals who are from our public school systems, who had experiences working with our schools, now to go over and transition and have an opportunity to work over at CAS to bring a lot of different new ideas, innovation, and equity and diversity to that organization. And they're not going to happen unless they're a part of TRB. And I don't expect them to come over to CAS if they have to come out of TRB. So that was my comment. I just want to add.
We will definitely research that again. If they're a nonprofit, they need to meet the qualifications of a governmental entity because it is truly defined for members of the public school system. So we'll definitely reach out to our legal team and circle back with you on those items.
Thank you. Are there any other comments or questions for TRB, Teachers Retirement Board? We will have a bill from the Teachers Retirement Board that will, this is a multi-year process that we have had to update the statutes so that they are with current practice at the TRB. And I think we're close to being all done, but just so everybody knows, it's something that we're working on. So. No, I don't see any other questions. Helen, you're all set.
All right. Thank you, everybody. Have a great day.
Thanks. Up next, we have the Connecticut State Library. Okay. Hi, how are you?
Good morning, everybody. I am Deborah Schonder, the State Librarian. And before you today are three proposals for the State Library. One is reinstatement of some funding to support our law and legislative collection purchasing. One is to support the implementation of an updated inventory for the Museum of Connecticut History. And then finally, there's also a proposal to use existing funds to increase our staff and support the work that we do at the agency. So I would be happy to go into more detail on any of those or answer any questions for you.
Thank you. So, you know that I've long been affiliated with the deafblind community. And I was talking with the community related to blind and sighted issues folks. And one of the dollars that are in the budget that are in ARPA being spent right now, have until 26 to spend, that's been allocated for them, is setting up ways for people that are blind and have sighted issues to participate in our museums. And I know that there's a process or a policy before you to look at this in the museum that you just talked about.
Mhm.
Are you following through with them on that? That's ARPA dollars that we've already put in. They are going across the state, and not with our ARPA dollars, but because of all the good work they're doing, they're actually looking at museums in other states that they're being paid to do this work. These are products that are well used, very important. I want to make sure that you and the museum are participating in this. I know that they've offered it to you.
Yes, that is correct. Thank you very much for that question. They did reach out and we took a look at it. We did decline initially, in part for a number of different reasons. It has nothing to do with the organization, which I think is absolutely fantastic and is providing many wonderful services to that community. The reason we declined right now is simply a matter of timing. Our museum is currently undergoing significant modernization and change after a significant changeover in our staff. We're focusing on modernizing it in many different ways. And the staff that we have is currently, I will admit, overwhelmed with the work that we're having to do for basic upkeep of the museum. And so it was really just an opportunity to say the timing isn't right now for us, even though that organization would be providing a number of services. It would require the staff to do significant research and preparation to provide the materials to them, which we felt that under the time crunch with that particular funding we didn't have. But it was only a response related to timing. One of the things that we are doing with the Connecticut Library for Accessible Books and our Division of Library Development is we're also working with an organization called Perkins Access to do something very similar. And our museum was part of that pilot program related to developing materials so those who are blind or low vision or have another disability are able to visit museums, libraries, historical societies, et cetera, and they can get meaningful information about what is on display in those organizations. So it was just a matter of timing, but we hope that we'll be able to partner with them on other projects moving forward.
So I'm disappointed
Sure.
that you would not take part of this. I think it's just one more time when I brought an issue to you on blind and sighted people that we have put in state dollars to participate, and you say, not now, timing, when this is the time to do it.
Sure.
And when you're in the middle of modernization, I think you need to look at it again and reverse your decision. And quite frankly, I don't want to hear that people are too busy.
Sure.
I never want to hear that from any state agency, that people are too busy to take care of something. We have about 10,000 people in the state of Connecticut that are blind or have sighted issues. This is something that was supported by everybody in this legislature. And I think when you turn it down, It is just so disrespectful to the people that we really care about. I really, when they said that to me, that you had turned it down, I was like, why? Why? I really think you need to look at it again. And you talk about some outside agency that's going to come up and they're going to do essentially the same thing. This is something that we have in the state of Connecticut that other museums are clamoring for. Not only in the state of Connecticut, they're going to Alaska, they're going to other states, and they're taking on something, and you say no. This is the Connecticut History Museum. We need to care about our residents and those people that have cited issues. I am so disappointed. I can't tell you. Thank you. Any questions? Anybody have any questions for the State Library? Seeing none, I think you're all set. Please get back to us on that.
Thank you so much.
Thank you. Office of Early Childhood is up next. They're here.
Long time no see. How you doing?
I'm doing pretty well. Thank you, Senator.
Saw you the other day.
Yes, we
You
did.
want to talk to me about some changes that's going to be made over at the Office of Early Childhood? Or do you want me to say one of my biggest concerns that I talked about yesterday, and I said I was going to bring it up today? So you want to go first? I'll let you go first.
Sure, Senator. Good morning, Senator Austin, Representative Walker, Senator Summers, Representative Nuccio, and distinguished members of the Appropriations Committee. I am Elena Trueworthy. I'm acting commissioner at the Office of Early Childhood. Unfortunately, Commissioner Bai could not attend today due to family matters. I'm here, as the senator said, with a team of OEC staff to help answer any questions. The governor's proposal includes a really exciting effort to expand preschool through a universal preschool endowment. The idea is to accomplish this through transfers of available general fund operating surplus to be able to meet the demand for preschool for families across our state. We know that it is a very significant need when it comes to early childhood services and supports for families to receive those services early on and to be able to afford the care for children. This helps our economy, it helps families go to work, and it helps our children have very positive outcomes. The Office of Early Childhood has worked with the governor's office to think about the plan for implementation for this across our state, really building on the work that is currently happening in our early childhood system, early care and education system that we have in place. I'm happy to answer any questions or continue to go through some of the pieces of our budget and testimony.
Do anyone have any questions currently? You absolutely good. You want to let her finish first? Or it's up. Go ahead.
Thank you, Mr. Chairman. Welcome and best wishes to former
you.
Senator Bai. As far as the endowment goes, the discussed amount that that we're going to be dedicating to it for early childhood. How many of Connecticut's children that potentially could be qualified to go into a program such as this will be encompassed under the current endowment as it's funded and structured versus how many children are there in the state of Connecticut that won't?
Okay, great question. So, um, currently in partnership with the public school system, the OEC serves approximately 20,000 children in our care in the public school system for preschool, about 19,000 children. Through this proposal, being able to work it out through the year 2032, we'll be able to increase the number of children in preschool spaces. So 3-year-olds, 4-year-olds, and eligible 5-year-olds who aren't eligible for kindergarten by 20,000 children. In addition, we'll be able to reduce the cost for the existing 19,000 children within our system now. So making it more affordable. The idea is that for families that make up to $100,000 per year, this opportunity for preschool for school day, school year will be free. In addition, for families making between $100,000 and $150,000, they will pay $20 per day for preschool services. And so we feel that this is a huge step in the right direction to increase access tremendously. And by the year 2032, we anticipate 93% of the population of families who want preschool will be able to access it.
And that's going to work within the existing endowment framework?
The way that it is, yes.
Thank you.
Thank you very much.
Okay.
So I have a question.
Yes.
So let me take my time and make sure I get this out. So I participated on the Blue Ribbon Task Force, right? We spent a great deal of time on that task force. A whole lot of stakeholders were involved in that task force meeting. And there was a number of recommendations came out of that task force. One of the recommendations was a lot of people were concerned about was cost. And yeah, I think I want to put a dollar value to what we were referring to. I think it was in order this to work effectively at a very good effective level, we would need to spend about $2.5 billion over the next 5 years. So if I'm mathing that appropriately, that's about $500 million, $500 million a year for a very successful program of this caliber. Here we have an endowment, which I think is great. It's a great start, great first start, that we will put away $300 million in 1 year, and we'll be able to use 10% of that, which is about $30 million in 1 year. So I don't know about you, but I was a middle school math teacher. And if I'm, if the Blue Ribbon Task Force, where all the stakeholders came from all over the country and some of the best in the ability in the state of Connecticut said that we need to spend at least $500 million a year. And right now we have a great program that started us out with $30 million a year. I don't know, something's not mathing appropriately, in my opinion. That's one thing. Think about that. That's one part. The second part is, after our hearing yesterday, I went around and asked people in this building, how would this endowment actually work moving forward? And it says, all monies after the budget reserve fund is filled at 18%, all dollars after that will go into this endowment. That's how I'm reading this. So I'm thinking as a legislator, and no, thankful you guys get all you can, but are we saying every dollar that is put away after budget reserve fund is met will go into this? We have a whole lot of other programs and organizations and coming for us for funding. And we're making a decision that every dollar we have above what we budgetary and required to do is going to go to early child. I would think that would be great for those who need that, but I don't know how that's going to work. And the last part of that is, what happens when we don't have surpluses?
Yeah,
And we already started a program that somebody said last year that cost $500 million to spend, but we're starting off with 30, and now we're in the year, we have 2 years and no surpluses, and we already got programs up and running. How does that going to work?
Yeah, no, these are really great questions. And I think what we can do is bring some of the data that we have used, right, to work through the numbers through 2032 to the working session, along with details as to, how the endowment will function and whatnot. And we'll be able to dig into it a lot more in those working sessions.
Okay, that's good. I appreciate the answer because I think there's a lot more work we have to. There's more conversation we need to have. I'm not
Absolutely.
I'm not against it. I'm an educator, but the numbers have to make sense to all of us before we get up and support something that's very new. Lastly, my last one says, I won't. And I'm sure you don't have this in regards to private. How many of these dollars going to support private providers? How many are going to go to schools? That plan has. I'm sure that plan hasn't been put together yet, has it?
No. And again, we can bring a little bit more of our thinking to the working group around that. I will say that we want to expand the system to include, right, additional providers who might not be a part of the system right now. So,
Okay. Any other questions? Representative Exum.
Good morning. Good to see you. I just have a question regarding the proposal for the birth to three funding. If you could give us a bit of an overview around that, and also around what the tiered rate system looks like as well.
sure. And I'm going to ask Nicole Cosette to join me, who's the director of Birth to Three, to provide some
Thank you.
additional details. But as I'll kick us off, and then just when you go to introduce yourself. So funding is provided to implement the Birth to Three tiered system recommendations. And this is based upon the Medicaid rate study that the OEC conducted with a consultant, or consultants conducted that for the OEC. So aligned with that, in the budget, you'll see a $6 million increase to the Birth to Three rates. And also to note, there is some dollars in the DSS budget as well to support the Medicaid side of the Birth to Three rates too. The tiered rate system is something that the OEC is supporting in order to support the credentialing and professional development of the Birth to Three providers in the workforce. But I'll hand it over to Nicole to talk a little bit more about that.
Thank you. I'm Nicole Cassette. I'm the director of the Birth to Three system in Connecticut. And in addition, I would add that the tiered rates really emphasizes our responsibility as the lead agency for Part C of IDEA, the Individuals with Disabilities Education Act, to really enhance our comprehensive personnel system and really ensure that high quality supports to families are provided across the board. So this really allows us to implement tiers to supplement payments to programs as they increase their capacity. And as they go through certain trainings, such as service coordination, for example, they are able to then bill at a higher rate. So that's about the tiers. This came out of the Public Consulting Group's rate study cost analysis that occurred about 1.5 years, 2 years ago. And we are in support of the governor's proposed budget and really look forward to what this could do for our system and funding providers.
So can you explain how that is different from our current system, the tiered versus, just kind of explain that as well, please?
Sure, that's a great question. So currently we have 2 tiers, if you will. So there's a professional rate and then a paraprofessional rate. What was suggested in the rate study cost analysis is expanding upon that. So it would be 5 tiers. So advanced professional, a middle range professional, and then your current professional, which, and then for paraprofessionals, it would be broken out into 2. So paraprofessional with the additional trainings, and then paraprofessional.
That's all for me right now. Thank you.
Thank you. Are there any comments or questions? Representative Walker, I'm trying to make sure I just got back in my seat.
Good morning. Good morning. Sorry, I didn't hear the questioning, the discussion earlier. I just have a couple of quick questions. One of the things that I'm curious about the proposed funding. Does the proposed funding, and if I apologize if somebody's already asked that, does the proposed funding in here give us serve more kids in this, or is this basically providing more funding to the providers, which I'm not against. I'm just trying, we had an increase a couple of years ago where we thought it was going to provide for more slots. It didn't. It provided more money for the providers, which was fine, but our universe is growing. And the whole purpose of, I think, and I hope, in the additional fundings that we're doing now, as we've said, is to address more needs in families. And my other question on that also is, how big is our unit? How many kids in the state of Connecticut need childcare, and how many do we provide? What percentage of that?
Right, thank you for those questions. So in the governor's budget, we do see increases in rates, right? Which would go to current providers. So we see a 4% increase for Early Start Connecticut providers, and we also see the increase in rates for Care for Kids providers. I think where the increase in spaces would definitely be seen is through the work of the endowment and the universal preschool endowment effort and approach. In addition, we
So
have.
Can I just ask?
Yep.
So in the endowment, that is future, correct?
It is future.
It's
yeah,
not current.
correct.
Okay, so
Yep.
current. So let me go back to my second question. Maybe I need that. How many slots do we need in order to have full access for everybody, and how many do we reach? Let's start with that question first.
Sure, and I think it would be best to provide some of that data, specific data in the working group, because really it's broken down by age group
Okay.
as to what is the demand versus what is the supply, right? So it's different for infants and toddlers versus preschool versus before and after. So we can bring all that data to the
Absolutely.
worksheet.
So,
Yep.
okay, okay, yeah, I would like it broken down
Broken down by that, sure.
by subject matter or age bracket or whichever you call it.
Yep.
Okay, so in this budget, this gives providers more, 4% increase, but it doesn't expand the universe that we are trying to serve.
Yes, for the most part. It is important to note that, stability in our early care and education system continues to be critically important, right? So as rates are increased, as more money comes into the system for child care programs, they're able to potentially pay their staff more. They're able to recruit staff, right, to be able to maybe open classrooms that are currently not open right now. We still have some space in which utilization can be filled and whatnot. So all of these pieces do add up to potentially more children in spaces. I will add that we have been able to, over the course of the last year, add 900 new state-funded spaces to our system. And so we have been able to expand through other ways and also increase the access for Care for Kids by 1,500 children within the last year.
I don't think anybody, we definitely want to provide a living wage as much as possible.
Yeah.
For people, because this is a critical need for us. But I think I think we must be honest with the public when we put money into the budget and say what it actually does. Because that's what happened 2 years ago when we did this. And as I talked to some of the providers, I found out that we were giving an increase in their salaries, but it was not providing for more spaces. So that's why, and we're playing against two things.
Yeah.
We're playing more money and
Exactly.
more spaces. However, this is a very turbulent year when it comes to money. We all know that. So now as legislators, we have to figure out how do we use what little money we know we have, and possibly that's going to evaporate before the end of the session. So we've got to make more clear decisions and also know the facts of what they are in order for us to have informed and not get caught like we did 2 years ago and ending up 2 months later, people saying that they needed more slots. And we said, wait a minute, we gave you slots. And they said, no, you didn't. You gave us money, which we were appreciative, but we
Mhm.
need slots now. So we just have to answer it. So thank you. Thank you
Yeah.
very much for those answers. Thank you. Wait, she has a list of people.
She wasn't in here.
Representative Nuccio.
Thank you, Madam Chair. So I just want to clarify a few of the points here. You had mentioned that we have 900 new seats that were being supported. Can you tell me where those seats are, what programs they're in?
We can bring that data to the working group for sure.
I would appreciate that. In the early start, just to confirm, that's just a 4% increase in the rates that we're paying. That's no seat expansion, correct?
That goes towards rates, correct?
Okay, and the $6 million in birth to 3, is this going to increase capacity?
This is for rates also.
This is, what percentage is that increase for rates?
I'll have to bring you that specific percentage.
Okay, and then the the 3 million for Smart Start, same question.
Right, so 3 million for a Smart Start. I just find that, so goes for two pieces. So during using ARPA dollars, we were able to increase Smart Start by 16 preschool programs, serving about 240 children. So this funding goes to continue that, plus increases the classroom payment from 75,000 to 97,500. So it keeps the spaces currently available and increases the amount for operating expenses.
So is that 97,500, that's just operating expenses? You're just, so that's a straight increase in rates in that case?
Correct. Mhm.
And is it opening up any new seats?
Not with this current funding, to my
Okay,
understanding.
in the Sparkler app,
Mhm.
how many people are currently registered on that app?
We have about 33,000 families currently registered.
And
using
all
the
of
app.
them are all of them active?
So I think we can define that again in the working group, because I think there's a couple of different definitions of what it means to be active, but 33,000 families are enrolled.
Okay, I'd like to understand how many of them are active and how much is the cost per user? Because I know this is 100% supplemented by the state. So
It is free for families. Yes, we can bring the cost also.
and can you
per
also tell
user.
me what exactly is this? How is this app helping us? What is this app doing to reduce any of these other costs or anything else?
Yeah, no, great question. So Sparkler, we've really seen boom across the state because it is a direct support for both families and with young children, and also we just launched the prenatal aspect of Sparkler as well. So pregnant moms or individuals can sign on to get ready, right? To understand what it means to have a newborn, what are the things that they can be doing right from the start and prenatally. But Sparkler is a wonderful resource where parents have this app and they're able to use the ages and stages questionnaire to work with their child to understand where are they developmentally, right? With language, with gross motor skills, et cetera, right? As a new parent, you might not know all the different developmental milestones that your child should be, achieving and by when. And so this is a really family-friendly way to identify maybe there are some potential concerns or red flags, right? Where my child, isn't crawling by a certain, age date. And then it gives parents the ability to use activities and ideas of how to promote that skill with their child. And so it's specifically targeting some of those pieces. And we've heard just a tremendous positive feedback from families who use that app. And when there's a red flag, it's also able to be shared with their child care provider, those results, right? So there is cross reference to where the child is and the different environments to be able to support their development. In addition, it's connected to the Help Me Grow Child Development info line where parents can call and say, I have these concerns, about my child. This is what the Sparkler app is showing me. And to get referrals, for example, to Birth to Three if there's a need for, some additional evaluation and support. So it's really a systemic approach and a full service of supports for young families.
Okay, thank you for that information. If you can bring the total cost that we're paying for this, I'd like to understand that because it's just kind of lumped into Birth to Three. And then in the universal nurse home visiting, the 1.8 million, what is that? And again, is this creating anything new or is this just an increase in rates?
Yeah, so Universal Nurse Home Visiting has launched in Bridgeport and is very soon launching in Norwich. And so this would be to continue those pilots in those two communities throughout that fiscal year.
Well, what I'm trying to get at is I'd like to understand what the pilot cost is. And,
Okay.
it's just in Bridgeport right now. So is the 1.8 million to add it to Norwich?
I can get you those details, but I believe it's to support both pilots and their continued efforts.
Okay, and then the Tri-Share pilot program. This here is saying it's just in New London County, so I'm gonna get a little irritated because, I don't see anything in the Northeast anywhere, right? So I'm seeing Bridgeport, I'm seeing Norwich, I'm seeing New London, certain counties have these great pilots that are costing us millions and millions of dollars, but how does that translate out to rural Northeast and Northwest corners of Connecticut?
Mhm.
So I would like to understand how long this pilot has been going on, how many people it is servicing, and is this an expansion of that, or is this just an increase in the rates?
Great, we'll bring that to the working group.
Okay,
definitely.
And while you're talking about Tri-Share, excuse me, Representative, we're the only part of the state that's requiring a business to pay a third of this. Electric Boat is paying a third, the state's paying a third, and the people are paying a third of this. I don't think there's any other business even that has even been approached to ask about paying for this. And I don't think that this program's off the ground. When I met with Electric Boat, they said that they had not finished with the compilation of this. And so I don't think it's even started yet.
Right, we have the first employee, I guess, enrolled, and so they anticipate to start in March.
yes,
for
I'm
it to be
sorry, but if
launched.
you have one employee and you're adding 1.6 million to an existing budget, I'm worried. I'm worried.
Well, yeah,
I'm a little concerned. Yeah,
Yeah.
right.
I mean, right, and so this is the creation of a pilot, right? And so the partners are doing active recruitment, and we do anticipate that that will grow tremendously. And so all the pieces are now in place in order for that to happen.
Yeah, I'd like to understand more details. What's the current cost? What's sunk cost already? Well, how many people we're looking at? As Senator Austin mentioned, are we reaching out to other businesses? And why am I putting 1.6 million into a plan that has one employee in it right now? And that's additional cost. So that's the Child Center Development, holy moly, Capital Child Development Center. Can we find out also how many people are in that program
Sure.
and the makeup?
Mhm.
And then I only have two more questions. One is the Care for Kids. As Representative Walker mentioned, I raised that 2 years ago that we were increasing rates and decreasing seats. But then you just mentioned that there were 1,500 new seats added. So
Yes.
has that been added over the last 2 years?
Yes.
And does that get us back to the numbers that, I don't have the 2 years ago budget in front of me, but we were cutting a substantial amount of seats. We were just increasing rates and cutting. I think if I recall, it was something like we were going from 24,000 down to like 18,000 seats. I could be totally wrong on that. It could be 2,400. It's been a couple of years. So I'd like to know how that 1,500 seats translates back to what we were at prior to the 2-year budget. And is this increase of 35 and 38 million dollars just an increase in rates, or are we getting more seats?
So the money that's currently in the budget is to go towards rates, an 11% increase for family childcare and a 6% increase for unlicensed care. This is aligned with and meeting the requirements of the union contract.
This is a union contract. I wish I could get an 11% increase somewhere. Okay, the $5 million for early childhood development initiative. Can you talk?
I'm sorry. I apologize, Representative Nuccio. But we have been required by federal law to increase our care for kids rates. And I thought that you did not say that, so I don't know if you're just not quick on your feet there. So, but that's the reason why it went up 11%, because we are so far behind in care for kids on that the federal government is requiring us to raise our rates, or we would not get care for kids dollars from the federal government. So I want to say that because we need to make sure that, you know, that people understand we don't give 11% pay raises to do 11% pay raises, but we were at jeopardy of losing our federal funding. And I don't think we're quite there yet either. So when you bring back the information, and any information that Representative Nuccio is requesting goes to our administrator, and we want to make sure that we are where we are in regards to being responsive to the federal government and I don't have any idea how to say that, but to whatever the federal government is getting us to. So I'm unsure where we are. So Representative
Yes.
Nuccio, back to you.
I agree. I'd like to understand where we're supposed to be, where we're at, and what the glide path is to
Yep,
get there. What
absolutely.
that would require in updates. And then the last question that I have is to provide funding for early childhood development initiative. Same question. Is this an increase in rates, or are we increasing seats in this?
I'm sorry, can you, which, the
It's
early,
Provide funding for early
Oh.
childhood development initiative.
yeah, so these are two studies that are underway at the Office of Early Childhood. And so it would be to continue those studies to be able to, you know, track outcomes and impact. And so the first one is around early years, which is a partnership with UConn, linking state-funded childcare providers and home visiting providers, connecting them with a parent consultant and studying the impact of having family supports wrapped around childcare and what that means for outcomes. The second one is around measuring quality child-teacher interactions. That's a partnership with the TMW Center using a Luette, which is a language interaction device that is worn by children to understand what are the types of language interactions, how many are teachers having with the children, and linking that to professional development and quality, right? Because we know that those types of interactions are critically important in every environment, especially in the early childhood classroom space. So the funding goes to support and continue those two studies.
Okay, can you bring how much money we've already put into these two studies and what this 5 million, what is the continuation period for this
Yes.
5 million, please?
Yes.
I'm sorry, when did we start these studies? Or have we started these studies?
These studies are underway.
When did we start them, and how much have we put into them already, as Representative Nuccio asked?
Right, I believe it's a total of 5 million that were used with American Rescue Plan dollars, and
Okay, so it's
they
going to be
were
a total,
started several.
it's a total of
a
$10
year.
million for a study.
No,
You said
I'll
that,
get you the exact. I don't want to miss.
please.
Thank you.
Thank you. Representative Corpus, I'm going to go to Senator Summers next as the ranking member, and then come back to you. Senator Summers?
Yeah, yes, good morning. I just have two questions. The first one is I'm concerned about, excuse me, the new funding proposed in the Office of Early Childhood's budget for 27. You know, how will the proposed increases for the services in Medicaid ensure that we have an adequate number of providers to meet the need? And if you can't get
Right.
back to me on that, then you can supply that to Susan for all of us to take a look at. That would be my first question. And then my second question is, I'm concerned about the gap funding process. You know, I understand that rates are specifically for direct services and, you know, salaries for providers, blah, blah, blah. And the general administration payments are to cover the other expenses for coordination, administration of staff support, offset the work, not making appointments, et cetera. But the governor's proposal or budget to me looks like it's going to eliminate the gap funding. And can you explain how that elimination what's that going to mean for our providers? And how will those expenses that we're seeing under the gap be paid for? I think that's a concern for me. So if you could get back to us on that, that would also be greatly appreciated.
Absolutely. Can provide a little bit of context around that. We know and have heard from birth to three providers that stability is really challenging for them right now. And so these increase in rates would help to stabilize the field and ensure that those providers who are operating in this space are able to continue to do so with high quality services and supports. The reduction in the gap payment is $1 million. It is just a reduction. It's not a complete drop of the gap payment. And with the increase in rates, able to start to decrease the dependency on the gap. But it is still our intention to make sure that birth to three providers are stable.
Okay, I guess I had one more quick one that you can again get back to us, and on the other two that I asked too is we talked about, or you talk about this tiered rate system, and I'm struggling to understand what's different about the tiered rate system than the current rate system model, and how are the program rates changed, and how are providers going to be kept whole? So that's another concern of mine. If you could let us know, that's important.
Yeah, absolutely. We'll bring some great detail around the tiered rate system.
Okay, thank you.
All set, Senator? Okay. Representative Corpus?
Thank you. I'm back on the universal preschool endowment. Just to clarify, the literature here says, and I've heard that this is 3, 4, and 5-year-olds. So this is truly preschool. This is not covering children younger than that, correct?
So the approach is around expansion of access for preschool. However, we know and understand and have learned from other states who have implemented some of this work already that we need to be intentional around our whole birth to 5 system when we make changes around expansion and access. And so part of the approach is to ensure that as we increase rates for preschool providers, we're also doing equivalent in the infant and toddler space in order to ensure stability. It is much more expensive to operate an infant and toddler program. But it's absolutely critical. That's still where our most demand is across the state for families. And so we have that built into the plan to ensure stability across the way.
So some of this actual money will go towards that birth to 3 years old as well to increase rates, or is that happening through some of the other programs we've discussed today?
Yeah, so I think we can bring some of those details as to what that looks like in the working session and where that would come from.
I think that would be helpful, at least for me, to see a list of all the programs we're doing birth to 3, so we can see where we're covered, and then all we're doing from 3 to 5 before they go to school would also be helpful. And then lastly, again, on the UPE. So this is a little bit of an unorthodox funding model for a program like this, it appears to me, because we're taking 300 million of current dollars basically offline completely and relying on the income generated by that 300 million to impart fund subsequent years, as well as more money we're going to be putting in subsequent years, correct? So who is going to manage that 300? Is it going to go under the jurisdiction of the treasurer who manages our pension plan? Is it going to be invested the same way? Are we going to have a whole new office of endowment management for which returns will be available and we can see how our endowment's growing? Like, how does all of that work?
Sure, and I think, again, we can bring those details to the working group to ensure that all those different components are more detailed out for you all. But it does state in legislation that the treasurer would be, managing some of those funds.
Okay. And this may be a function of this being my first term up here, but to me, the more baked this is, the easier. I mean, I'm on board with the idea of early childhood support. But the less baked it is, the harder it's going to be to support it because of the magnitude of the money and the future commitment, as Senator McCrory said. But I really look forward to the next meeting. Thanks.
Yeah, absolutely. We can definitely provide much more of a description as to how we see this rolling out and programmatically and what the impact would be.
Thank you.
All set, Representative? Are there any other questions? I have a couple questions. I just wanted to make sure everybody else had a chance. I've been looking at the numbers in Norwich relative to pre-K, and they have seen a decrease in the funding next year, close to $1 million, which will significantly impact their ability to keep current services in pre-K in a town that's the size of 40,000 people, as considered a distressed municipality. And with all of the other complications that we have had in Norwich, with 900 people on a wait list for ELL and other things, I just don't understand that. So if you could bring to the work group what every a spreadsheet on what is being sent to each community for pre-K, and what it was the last 3 years and what it is in the biennium, where that is, so that we can figure that out. And the birth to 3, we annualize the private providers. Do you know if this brings birth to 3 up to a current rate for their providers? Because we hear a lot from birth to 3, and sometimes they fit in with private providers, sometimes they don't fit in with private providers. It all depends on the day of the week and whether the sky is gray or blue. It's not anything to do with you. It seems that sometimes our statutes are not
Right. With the private
aligned.
provider payments.
And
Yes.
so I'd like to know, where are we on birth to 3? Are the providers having a rate that brings them above minimum wage? And what does this do relative to their rate of pay?
Okay, we'll definitely bring that information. I don't know, Sarah Poulin from Fiscal, the private provider payments include birth to 3, correct? They do. So no, she doesn't need to come up.
Say
So
it again.
the annualized private provider payments, I just wanted to make that clear, does include birth to 3 providers. But I think your second part of your question is around the rates and making sure
Right.
that the rates are aligned to the support.
I
Yes.
see that it includes birth to 3, it's
Mhm.
right here, but I don't know that that solves the problem. And that's my concern is, are we solving the problem for birth to 3? Have we finally gotten them to a place where they're making what they should be making as a birth to 3 provider?
Right.
And I hear from birth to 3 providers all the time, and they're not all over the map on that question. On that question, they are totally saying that in a number of times when we have raised rates for private providers, it has not always included birth to 3. And
Right.
so I'd like to know what is their rate of pay now,
Mhm.
and when this is annualized, what does it bring? So not only what is it currently today, but what is it going to be over the next couple years?
Right, and we'll definitely bring this. This is directly connected to the rate study, and in the budget, the increase of $6 million specifically for birth to 3 providers for rates. But we'll bring that information.
Thank you.
And those rates have not been increased since 2017.
That's
so-
my,
Right,
that's
so here you
exactly what I'm
see the-
saying.
Exactly. in the
Thank you.
budget. Yes. the
Because that
investment.
is exactly what I'm saying. I'm trying to figure out,
Yep.
what are we doing that can we finally end the discussion on birth to 3 and recognize that they fit in or don't fit in? And what statutes do we have to change to make sure they fit in? Whenever we do a rate increase for private providers, it seems that sometimes they fit into the rate increase, sometimes they don't. This is not your issue. This is a statutory issue, is my understanding, and I'd like to fix the statute so that we can make sure that they always fit into a rate increase when we're doing other private providers that, this is not you at all. It's apparently a conflict in statute that leads us to this discussion all the time, and I'd like to fix that. That's what I have right now, and if you could get me that, information on who is losing money in the next couple years on the pre-K, that would be helpful.
Sure, and just a little bit of context around that. And so we want to make sure at the Office of Early Childhood that all the dollars that are going towards early care and education are being utilized. And so what we have seen is that there are areas in where utilization is not at 100%. And so we have looked at that when it comes to the allocation of dollars under Early Start Connecticut. But it's important to note that programs get reimbursed for the children that they're serving. And so those dollars potentially, and again, we'll pull the numbers for you around utilization, is that they are not losing dollars that they had from, last year, for example. Those spaces were never utilized in some instances.
So we've asked for, the Norwich delegation has asked for a meeting because that's not what our school is saying. They will lose $636,000 and then, directly related, and they have more children today than they did 2 years ago.
Okay.
And so if they're using more children, they should get more money, not less money. And that's where the complication is. And so we've asked for a separate meeting to discuss that situation so we can iron it out so everybody is on the same page. Whether they like where we end up is a different discussion, but let's at least be on the same page so we're all talking the same language.
Sounds good.
Okay?
Yep.
Anybody have anything else? Seeing no other questions, you're all set.
All right, thank you.
Thank you. Up next, we have Dr. Pritchard, the CTEC system. I'm starting a little bit late for you, ma'am. Are we shutting them down now?
Yeah, they did. He did.
Thank you.
You know, Kathy's pit bull. Kathy.
I was gonna say. Exactly.
I know.
Dr. Pritchard, how are you today? Yes, I know.
It's good to see you.
We're all thinking about her.
Alice, it's been a long time. Yeah, no, but back in the day in WIOA and I mean, what welfare reform is where we first started.
Oh,
That was a long time ago.
you gotta turn your mic on, Alice.
94.
Thanks.
Because
That's
I
1995.
was like, when was it was when we started welfare reform.
Long
I was
time
like
ago.
a long time ago.
So, are you done commiserate?
All right.
So do you have any beginning words, Dr. Pritchard?
I
I'm trying to call her
I should
doctor, you're calling her
introduce-
Alice,
I know, I'm so sorry. You called me ma'am too. That was very strange. I should introduce myself probably, and then I won't say much more than that, but Senator Austin, Representative Walker, always wonderful to see you. Senator Summers on screen and Representative Nuccio and members of the committee. My name is Dr. Alice Pritchard, and I am the interim executive director at the Connecticut Technical Education and Career System, CTEX, if you don't know it. I do have written testimony that talks a little bit about the system. I encourage you, if you don't know enough about it, to read about it and to please reach out. We'd love to talk more. I just want to say a couple of quick things though about the fact that we this year have more than 11,000 high school students in our 17 schools and more than 3,000 adult students who are in apprenticeships and other training programs. We are the future. An investment in our system is an investment in our workforce and in the state's future. So the governor has proposed resources for our personnel and for our operating expenses. Those align to our current expenses and our deficiency spending. So it's an attempt to make us whole and includes gaps left by the end of ARPA funding for our system. So happy to answer questions today, take questions and bring them to subcommittee. And again, just really encourage you to
learn more about these schools. If you don't know, I'm visiting them all myself right now. Happy to have you tag along to see the wonderful things that are happening in those schools. So I'll stop and let you, I know we're running a little behind. So thank you. I'll let you jump into questions. You said
All
you-
right. Thank you for that. So I have a couple questions.
Yes.
One, you were using a system of merit to bring kids into the CTEC system. They did videos, they did a whole host of things. And then it went to a lottery system. I got a lot of complaints about that. And then it seemed to go away. And it went back to a needs system, and some kids turned in other videos and did a bunch of summaries on why they would want to do little essays on why they wanted to go to the technical schools. And now it's back to a lottery system. And I don't really care which system it is, but some kids got notices when it was needs-based that said, a merit-based system that said they were going to go to the tech schools. And then we didn't do that anymore, so they got a notice of rejection saying, well, after they had gotten an email saying that they were going to be a part of the tech school, then they changed the system on how they were doing it. And so they got another email that said, no, it's not really true. We're going to a lottery system. And then some people were in the lottery system and they said, you're going to be a student here at the CTEC school system. And then they got another email saying, you're not going to be a student. So can you clarify, how does someone get to be a student at CTEC? and if children can show that they were approved by a merit program for the next year, and prove that they were having that taken away because we decided to go to a lottery, and the same thing with the lottery, is there any way that we can fix this problem for these kids who have been given different messages on how we're entering the CTEC system?
So Senator, first of all, that's it's just a very frustrating story, obviously. And we did go to a lottery, and for good reasons, given concerns that were raised about how we were handling students potentially who had special ed needs, disabilities, or discipline issues in their sending schools. So the move to the lottery does, and it aligns with the way in which we do our RESCO schools. So all schools this year went to a lottery. The prior to stuff is before my 2 months. I would be very happy to look into those things that coming going. If they were told that they would join us in this coming year, they'd be joining us as 10th graders. So I think we need to look into that. They wouldn't be competing with the 9th graders necessarily for spots, although they wouldn't have started with us yet. So it's messiness, and I'd be happy to look into individual cases and have our team look at it. I do think the lottery is our likely continued path forward. We don't know the results of it entirely yet, except for that I will say we had more than 6,000 applicants for less than 3,000 spots. So we do have, more than 50% of parents and students right now who are not very pleased with us, understandably, because they didn't get a spot in a school that they really care about. We've had a very high acceptance rate of those students who did get a lottery ticket and got in. We have a very high acceptance rate, which again, I think speaks well to how excited people are about coming to the tech schools. But I think we have to talk about what we're doing with those that we can't accommodate. And then also to those who in the past year have gotten this mixed message of in, out, as you're suggesting, we should look into, and happy to do that. I understand there's some Norwich specific situations that we could look into.
Yes, Representative Wilson brought those to my attention. A lot of them happened at the integrated day charter school. And he has seen the emails that both awarded and removed them from that award. And that's hard for kids when they have done everything that they were supposed to do, and to get an award and then plan their life. By the way, they plan their life 5 minutes after they get an email. You could have sent an email 6 minutes later and taken it back, but they've already planned their whole future. Plus, I do think that the manufacturing pipeline is very important in Eastern Connecticut. And there were over 200 kids that were at a signing ceremony just, at the end of the last year's school. And those kids they were from all over the state of Connecticut. They were so excited to be going to work at Electric Boat, where they started a job at $52,000 a year with benefits, healthcare, and a 401k for an 18-year-old is something that really, and their families were there. They were so excited. So I can see why people are excited about the CTEC system. So Senator McCrory has done an awful lot of work to bring up the academics of CTEC. Where are we on the academics of the CTEC school system? Is it at a level of a traditional high school in coordination with their trade that they're looking? Where do we stand on that?
Well, I'd be happy to have interim superintendent Burr come up because I know he would like to talk to Senator McCrory in general because they're old friends. But I will say that it is an area of keen focus for us at the moment. You know, it is critically important that we provide students with a foundation, an academic foundation that allows them not only to go into their trade, but also to go on to post-secondary if they should so choose to. And I think we have a number of schools who are not performing at a level that we believe they can and should on behalf of students. So I don't know how much detail you want to go into today. We can do it in subcommittee, or if you would like to have more of a conversation now, we can talk a little bit about it. But it is a concern of ours. We have a number of schools that are not performing at a level we think they could be. And again, I think it's not a indictment. It is a recognition that more resources are needed, more time is needed on task. You know, we need to bring more resources to bear, not less, on those kinds of concerns. We also have concerns, as every district does, around absenteeism. We have a high rate of absenteeism, particularly among, you know, higher than you'd want it to be for our special ed kids and also for our English language learners. So lots to work on here, I think. And again, happy to have a deeper conversation about it.
Well, I, for one, would ask you to bring that deeper conversation into the subcommittee so that we can actually talk about it, because I think it's vital for us to have a well-running technical school. And the number of jobs that we have available, not every young person is going to head to college, and getting someone into the trades can get them a middle-class environment. All due respect to the hospitality industry, someone that's going to be a plumber or an electrician or HVAC or knowing how to weld, these are jobs that can pay you very well and get you established. You know, when somebody's 18 and they're making $52,000, and that's not high rate of pay, but certainly is a decent rate of pay, in particular for kids that are probably still living at home. And so I think that that's important. I have a couple more questions, but I'm going to go to Representative Walker.
Thank you. And again, good to see you. Good to see you. Thank you for sort of breaking it down a little bit. So at what year did you start accepting special ed students?
We have always had special ed students
Really?
in the district. The numbers have grown exponentially. So if I can go to my cheat sheets, if you don't mind, because I want to make sure not to say the wrong stuff. So on special ed, as an example, we had almost 1,000 students in 2017.
Okay.
And we're now at 1942 today-ish. That number changed. I just want to be clear too. I'm learning that these numbers change each and every day. But so we're at about the same rate as the state at 17%. But our increase was more significant. So
It's about a 50% increase almost.
yeah. So the state went from like 14 to 17% in that same time period. We went from 9% to 17%. So really big change for us in terms of the students we were seeing, but we have always seen them. And again, I think, you know, our team has worked really hard this year at the school level and at our central office to analyze what we're doing in terms of services. We have 1,900 students with IEPs. You know, possible that we have students who have not been identified yet and therefore don't have an IEP. And so that's why we may have things pop up mid-year or even later. So we definitely have been in this work. I think what we're trying to understand is, to what degree do we have school-based resources. So we have school psychologists and social workers, and we have special ed teachers, and we've brought more and more of them onto our general fund budget over the last year. So we have an addition of 38 special ed instructors who are come in, and they used to be funded under ARP-ESSER, and they used to be funded under the IDEA program, but we've moved them onto the general fund. So we're increasing the resources and supports we have available to those students, but it is a significant increase at a time when our budget has not increased. So
Exactly. You're
right.
at 14 million right now of
Yeah.
deficiency. That's what I, so is most of your deficiency from your special ed population and the needs?
It is certainly from kind of unbudgeted
Right.
services. Again, I don't want to blame our
No,
budget
no, no,
issues
no.
on people, on
No.
special ed students. By
You don't have to
any
give us the names. We just mean, okay.
No, we're not going to do names.
No.
But it is that we really didn't budget for this level of service. And so that's certainly one of our challenges. So yes, we have increased both the personnel and the operating expenses related to special ed.
Okay.
We also have fixed costs that have gone up like every other agency, I'm sure, by about $1 million. And then I think what is just good news is that we did start this fiscal year kind of fully staffed. I say that in quotes, but we had gotten up to the allocated amount by OPM and surpassed it actually by the start of this fiscal year. And we're also hiring a little bit faster than we used to. And DAS would probably be
Please
very
give
happy to
us
hear
the
that.
formula because
Yeah.
we're all struggling there.
So we're hiring a little faster, which means more of it hits the budget,
Yeah.
you know, and but so I think that's our deficit. The other thing I would say is that unlike possibly another state agency where if they had a departure, they could kind of go 3 months without, if we have a departure in a classroom, we have to replace that person immediately. And so we'll replace a teacher with a substitute, not always the best solution, but the one we sometimes have at our disposal. If we lose a secretary, it's not that we lose somebody who's doing our scheduling and desktop stuff for us. It's somebody who's answering the phone when parents call. So we can't afford not to replace as quickly as possible. And so we can't, we can't do that little squirreling away of resources for a month or two to help us kind of balance this budget.
Okay.
So it's a number of things, but largely it is those costs. It is also our facilities costs. We're finally getting some good bond funds that are helping us do some things, but if we have something break at the school, that's not a bond expense, that's an OE expense, and we're doing that. And we used to be able to put that on the federal money, and that federal money is gone.
Yeah.
So
We won't
on the
talk
OE,
that.
on the OE for sure.
Okay, so drilling into the special ed cost.
Yeah.
You had 1,000 before, and now you're twice that amount almost.
Yep.
So because of that, you've had to, okay, one thing that most school districts, each school district has to cover their costs for special ed expenses. So you had to cover your cost that
Correct.
you were not prepared to do. Do you contract it out to like the IEP process? Do you contract out the actual interventions that they get? Do you contract those out, and do you have a specific vendor, or are you shopping around like everybody else?
Right now, we have a contract with CREC. We've had a contract with CREC for many years to provide additional services. They are a great partner for us in that they have a lot of clinical expertise and others that they can call on for us. They've also in the past year hired paraprofessionals for us. We're looking at that because that feels more like an ongoing cost for the system versus a contracted cost. But CREC has been a partner. Their contract is probably going to run us about $6 million this year for their additional services, but they provide it statewide. So even though they're Hartford based and we know them for that, they're helping us to staff behavioralists and others at the school level across the state.
Could you bring to the working group let's go back to like 2017.
Yep.
It was CREC part of the contract then?
I believe they were, and I have those numbers just not on me, but
Yeah,
at a
no.
much smaller,
Yeah.
at a much smaller rate.
So if you could just give us
Yep,
this window from 2017 to
Okay.
today, tell us who have you been contracting with for special ed?
Yep.
And what services are you getting? Because, I mean, it's not just you. You'll hear about this later on this afternoon. We're still trying to understand special ed. And it's something that's bigger than a bread box. And literally, there is no fixed determination on who they are and what they are. So I think we're still trying to understand it, and it's important that we have information from different districts or things so that we can look at and see, is there something that the state as a parent company, I guess, can help with in addressing our special ed costs for the services, so that we also can start to look at which are good prices and which are a little taking advantage of the needs. So
I mean, I do want to say they're supplemental to the services of our employees. So we spend about $4 million, I believe, on special ed staff. And so, you know, we're doing the day-to-day work, and CREC is helping to supplement that, but happy to bring you all those
but that,
details.
yeah, I mean, your staff and their staff, and if anybody else's staff
Yep.
is in, so that we can look, because your portfolio is
Yeah, it's a
not that it's small,
microcosm,
but
though.
it's
It's your
smaller
problem. Yep.
and manageable for us to sort of dig deep into and see maybe there's things that we could do to help.
That would
Okay.
be wonderful. We'd
Okay.
be happy to talk about it.
Thank you. Thank you.
Of
Thank you,
course.
Madam Chair.
Representative Nuccio.
Thank you, Madam Chair. So I have never been, the last 2 years I've been up here, I have not been quiet about my dissatisfaction with the technical school systems. And I'm looking at your budget now. And I noticed that there's about $13 million in deficiencies. 11 million of that is an other. And I was wondering if you could
Okay.
give me some explanation on that. And if you can assure me that we finally have an HVAC teacher in Wyndham Tech.
Wyndham Tech, we'll have to, I'll check on the Wyndham Tech. But I know everybody, I'm happy to check on all
Well,
of it, because
you
it's
know,
critical.
It is critical, and
It is
that's like I've said in the past, you know, I have had 4 nephews go through Wyndham Tech, and my youngest went through Wyndham Tech for HVAC and had 18 months of Disney movies because there was no teacher, right? So he graduated Wyndham Tech with an HVAC degree that really he can't do anything with. And it's beyond a disappointment to me. It's a fundamental failure. So, you know, I have been supportive of the CTECs. I want to see more seats available there, but I also want accountability and responsibility for the fact that these kids are actually learning. So, you know, we have increased the budget in the last couple of years. So I know there's a deficiency here of 13 million in each year, and 11 million of that is in other expenses. So I was wondering if you can please break down the details of what this is.
Yep, and we're happy to give you the details, but the big
Mhm.
chunks of the money are what I had mentioned. You know, we have about, we're a little bit of more than $1 million on fixed cost. The 6 million or so that's special ed related, additional costs not budgeted for, but we can get you those. And then the PS of being fully funded and not having that to kind of fall back on, but happy to get you that and confirmation on the HVAC.
Okay, and you guys are fully staffed, if I remember you here.
Yes, I mean, I want to keep using air quotes for your exact reason. There, you know, there will be you know, hopefully not the HVAC that we've talked about, but you know, we've been trying to fill a chemistry position out in Torrington. You know, we will have those pain points, and it is really challenging, first of all, to find somebody mid-year who wants to come. And so then we end up with a long-term sub situation. But we are, doing everything we can, but we have definitely gotten to, again, fully funded. And now we're dealing with pain points and trying to replace subs with full-time instructors.
Okay, so if you can just bring the details on what that 13 million breaks down
Yep.
to. And I know my colleague is going to ask about the special ed costs to get something, to get some understanding on that.
Yep.
Because I could be totally mistaken, but I'm going to let her answer the question, ask the question. I thought that like as the special ed, you don't get excess cost, do you?
I don't believe so.
No. Okay, so yeah, all right. That's really all that I have right now, Madam Chair. Thank you.
Senator McCrory.
Thank you. My comments are along the line what you said, Kathy, in regards to these great opportunities in these trades. 2 things. When we get to the working group, I want to dig a little deeper in how we can get you guys involved with our regular comprehensive high schools. I know we had talked about this before, providing opportunities for the trades to be brought into our comprehensive high schools, whether it's during the day or after school. So let's talk a little bit about that. And then also the evening programs that you have. So many of our young people who graduate from our comprehensive high schools go out into the workforce and find that, you know, what they're doing is not something they really want to do. But if they ever had an opportunity to be an electrician and go back to school, we have to provide those opportunities. You have the mechanisms in place, the systems in place all over the state to provide opportunities for people to go back to school, get trades. And my attitude and mindset as we move forward in education is when we provide opportunities for scholarships. You know, we have Roberta Liz scholarships. I want to be able to provide for scholarships for individuals who graduate from high school, and we provide them with scholarships going back to you and you guys train them to become our next electricians, our next plumbers, and all those trade areas. So that's that second thing. And last thing, we're doing a lot of things in our regular traditional public schools to diversify our teaching population. I haven't heard about anything what you guys are doing. Tell me what you're doing. You don't have to tell me right now, because I know you wasn't prepared for that question. But when we get in our working group, talk to me about what you're doing to diversify your teaching population and your administrative population in our schools. Because as you know, and I know, and everybody else know anything about education, that all children do better. All children exceed extremely higher when they're taught by a diverse teaching population. So that's what we need in your technical schools. We're trying to do our best in our traditional public schools and our other schools, but I haven't had a conversation about what we're doing in your tech system. So let's have that ready, okay?
That would be great, Senator. And I will say, I would concur with you that the student population is very diverse, and that the teaching ranks are not as, and so it's something we would definitely want to be working on, and I know we've had some efforts in the past. Happy to bring those
So
things.
before Senator McCrory runs out, because I know he has to run out, on that diverse population in the teaching staff, my understanding is a lot of people are not willing to leave industry because of the rate of pay. And so the administration has been looking at the rate of pay in some fields that are hard to fill, like medical staff in prisons. So we should be looking at we are in the middle of a contract negotiation, and I would think that they would certainly like to hear from the CTEC system on is pay for teachers an issue at CTEC, in particular when you have somebody teaching one of the trades. So where are we getting them from? How are we getting them? And is the reason why they don't want to leave their industry because they're making more money in their industry? They'd love to teach, and is there a way that we can borrow somebody from an industry on areas? You know, can we pay them their salary they would have made at the job that they were working? Like I use Electric Boat, or one of the subcontractors that's most familiar with it. But if we can pull somebody off that does welding down in the yard to do what Senator McCrory is asking us to do for the class period of that time frame, for 2 months or 3 months, and they go back to work in the yard after that, that may be an opportunity for us to bring real life experiences and do have a diverse population of teachers by borrowing from industry. So that's something. Representative Corpus, followed by Representative Leeper.
Thank you. Just a point of fact. Do you all in the CTEC system financially function like an outsourced provider for the special ed students? That is, a district would get funding if the child's IEP costs over 4.5 times that of the average student. The district would get that overage in funding, and then the child would come to you all, and then the money would follow the child. Does that happen at all?
That is not how it works for us.
No, okay.
You are helping us pay those bills directly.
Right.
We're not getting the excess that you're talking about,
Okay.
and the money does not follow the student.
You're carved completely out of the excess cost grant system. Okay.
That was put in a previous piece of legislation that OFA sent to us that said that that excess cost system would not apply to CTEC, that they would cover all the costs within the confines of the CTEC system, and that we would put in the dollars. And they don't even get the IDEA money or any of the other funding. You get
We
IDEA?
do get IDEA.
Okay.
You get IDEA. Do you function as a school district for purposes of the educational cost sharing, or none of the above? You're your
No.
own standalone
We are a state agency.
funding aid.
We are
Oh,
a
I
state
gotcha.
agency with our budget allocated by the governor
Okay.
and the legislature.
So if a child comes from a school district who has an expensive IEP, so to speak, that school district keeps the money on that child, even though the child comes to you. No, that child's carved out.
That
Well, the
child,
money doesn't come to us. I don't know what happens to the
they
money.
do not
but
get
yeah.
the money at the school
Right.
system any longer. That comes off of their rolls.
Okay,
What it says,
gotcha.
what the statute says.
Okay,
I don't know what, how is happening in practice. We can ask that question this afternoon when Commissioner Russa Tucker comes
okay, thank you.
for us.
for the
Representative
question.
Leeper.
Thank you, Madam Chair. I just also wanted to touch on, I think the point you mentioned about the struggle for the CTECs to be getting professionals from industry into the classrooms. And I think in the Education Committee, we're working with you guys on some suggestions for easing that transition so that it's not such a tremendous sacrifice for our industry professionals to enter the classroom. So I just wanted to make that comment because I've been actually pushing for that for a number of years because we can't possibly have kids who don't have the professionals educating them that they deserve. And we need to help make it more financially feasible for the professionals to come and give back. And from what I've heard from lots of folks, they got their start in the technical high schools and they're really eager to come back and give that opportunity for other students, but we have to help it make sense for them. And so whether or not that is an alternate pathway to certification for them or what have you, I'm excited to be taking on that work. So I just wanted to mention that. And then I also wanted to sort of ask about a couple unique challenges you guys have as both a school district, but also a state agency. And this is new and we're figuring it out. And a couple of suggestions I had heard were whether or not it would be helpful for you guys to receive 50% of your funding allocations up front while you're hiring your teachers, setting up your buildings, really getting the school year started, and then a quarter and a quarter, rather than each of the 4 quarters being dispersed separately. And I don't know if you had any thoughts on that, if that's something that would be helpful or is something you guys have been talking about.
No, thank you for the question. We do experience most of our cost at the beginning, really in July. So we're, as we're thinking about how to get our schools ready for students to arrive, we need to, get all of that equipment up and ready. So there are a lot of expenses that will hit us actually in June, but certainly would hit us in July. So that could be very helpful in terms of front loading those resources. I know that that's a challenge, but I think that would definitely help. And then you could, kind of stretch the rest out during the school year because the majority of our stuff is hitting at the very beginning. That's.
Thank you. I appreciate that.
Yep.
Madam Chair, may I add one more? One of the other things I've heard mentioned as I think future concern, not necessarily current concern, but as a state agency, you'd be subjected to any hiring freezes that might be declared for all state agencies. It'd be really difficult if you couldn't hire teachers for students that are already enrolled in your programs because there was a state agency hiring freeze. Has there been any conversation about carving out the CTECs from that provision within the governor's office?
I don't know if they've had any of those conversations. I will say OPM has been very flexible and worked with us on these issues because again, we have a higher head count than we were approved because of the importance of instruction. And so I think we would hope in that circumstance that there would be some flexibility. So if it, again, if it was safety, if it was instruction, that those are things that wouldn't fit under the freeze, but no, I don't know that there's been any conversations, but it would be helpful to think about how our circumstances are different, much in the same way you probably would still hire a doctor or nurse at, Demas as, just as an example on it, even under a freeze.
Thank you for that. I'm very excited to continue to work together through the subcommittee process. I am just an absolutely passionate believer in the work and opportunities you guys do and provide for our students and how essential you are into the career pathways that we want for our state. You guys are really the nexus there. So thank you for what you're doing. And I'm excited to continue the conversation. Thanks, Madam Chair.
Thank you. So I just want to go back to a couple of questions that I think you may have already answered, but I'm trying to understand. When we annualize the deficiencies that you have and we are adding in 30 positions, I'm confused on this one. Are we adding in 30 positions to your head count that are paraprofessionals? Are they behavioral specialists? What are those 30 positions that I think will, that according to this budget are being added in?
I don't think that OPM was specific and the governor's office was specific about what those are. I would just tell you that we're already well above that number. You know, in Representative Nuccio's question, she asked us for a full-time head count.
Right.
You know, today we're at 1609.
1609 right now.
And our number this year was supposed to be 1539. Again, OPM has been really flexible with us and allowed us to get higher. So you know, it's a recognition that we are actually already above, but it would allow us, it does recognize those, you know, 38 positions that we brought onto the budget in September and December, given
The paraprofessionals that you brought on.
they are not just they're not all paraprofessionals. They could be any special ed
So
kind
you're,
of related staffing.
you're currently paying 1609. I mean, you
Hi,
have as a
yeah.
staff 1609, and
Yeah.
even the governor's budget recommended 1566 more than you had as 1539, which is 70 positions less than what you have. So your head count needs to be corrected for what your actuals are. So bring that with us so that we have that head count. The head count has to be what you're paying. Is that, we'll never get the deficiencies down if we're paying more people than we have in as a head count. So that's something that I think that we have to do. And is it your goal to eventually cover in-house paras and behavioral specialists, or is your goal to do the contracting with CREC?
I think a combination, Senator. I think that I'd like to see if we could bring more of the para level work on, you know, onto our staff, onto our expenses, and leave those real specialists within a contracted service through CREC or others. But I think
So
that would be a better use of our expertise and their expertise if we had the paras and they had the behaviorist as an example.
So the day-to-day person that you need, maybe having a relationship with a student is what you would like to have in-house on a regular basis.
And we do have some of that, but it's not exactly baked in. So it may be a future, longer term plan than a short term plan.
So, all right, so thank you. And the 17 schools that you have, I saw the governor had Wyndham Tech as being completely renovated. Can you bring to us where the 17 schools are relative to being renovated? I mean, I know that the Norwich Technical School was the Notre Dame All-Girls Catholic High School where I went for a couple of years. I think they kicked me out, I'm not certain. And then it was Mohegan Community College, and now it's the technical schools. So I'd like to understand, where are we on fixing the other schools? Are you seeing a need to get other schools in other parts of the states upgoing? And the 3,000 adult students that you have, are they affiliated all with the manufacturing pipeline, or what are they affiliated with?
They can be doing their apprenticeship trade related content with us, so they could be in the traditional trades. We also have adult students who are in the aero maintenance programs, which are in Stratford and Brainerd Airport, two really critical programs that we would love to grow to meet demand in the state. So a whole range. And I think that's a real opportunity for us for expansion as the adult.
Can you bring us what those 3,000 adult students are, where they are participating, and what programs they're participating in?
Yep.
Thank you. Are there any other comments or questions? Seeing none, you're all set.
Thank you.
And I remember you from Guelph.
I know, I'm getting older by the minute in this hearing. Yes, we did incredible work together at DOC.
Yes, we
You
did.
were a lieutenant still.
Yeah.
Yes, yes.
Yes,
Thank you,
we
Senator.
did. It was
Thank
a
you,
long
members of the
time
committee.
ago.
Yep, good stuff.
Thank you.
all.
You're all set. Okay, so our next group is not until 1 o'clock, so you're all free until 1 o'clock. We'll just pause our meeting right now. See you all at 1. All right. We do it for elementary and secondary education tonight.
Yeah, but do you know when they're gonna do the higher education again, or?
Next year.
Oh, okay.
Yeah, we did it once. We don't do it again.
Stand up. I know I'm packing my stuff. And I'm sitting here scratching my head. Yes. Yes.
Right, I think there's enough evidence, national, find try to find it. Right, yeah, and then I think we second half. Yeah, we've done some of that, we have some of that, but yeah, I think it's, gotta find a way to do it, like, exactly, yeah, not everything is, right? Right. Right. Very clear what it is. Yeah, yeah. If you have any questions, I'll be happy to. Yeah, yeah, I talked to her. Okay, not about. Yeah, no problem. Third. I mean, those sit on the end, they're going there or they're depending on where she's at. And then, you know, so they're, like, good. So, what is the article? It is. For 24, 25. It is. Yeah. Yesterday we were saying it's for the first year of the budget. I think it's the year zero of the budget. Yeah. Year two of the last, the current budget. So are they only going to put in 40 million for the first year? TBD. But they're going to second house in the second house in the funding. They're going to go over the immediate. Yep. Wow. How's that opposite? I passed the bill up there. Did you? Yes. I signed off on something. Did you experience sitting here? I sat at a corner of a conference table. I'm unique. I don't want to lose privileges. Don't bury yourself in the middle of people. Being after that. That's the one. I hate that. Oh, I could probably say. I got Roger right next to me. No. Oh, your physical partner. Oh, with, that's positive, I think, the revised number would be higher than 5 or whatever. Then it still be that.
Huh? What time is it? Oops. Good afternoon, everybody. It's a pleasure to see you all. If you all want to take your seats, that's good. So we're going to go to our afternoon presentation on the State Department of Education. And we have in front of us today Commissioner Charlene Russell Tucker. Commissioner, do you want to say a few opening words?
Yes, Senator Austin, Representative Walker. I know they're not in the room necessarily, but Senator Berthel, Representative Nuccio, and members of the Appropriation Committee, I appreciate the opportunity to appear before you today to discuss Governor Lamont's proposed 2026-2027 budget as it pertains to the State Department of Education. I will be brief. I know that's what you've asked us to do. We're extremely thankful that Governor Lamont's budget includes expansions that are reflective of some of the department's important initiatives and priorities. These investments include commitments to $40 million funding increase for the excess cost special education grant beginning in fiscal year 2027. 2026, it eliminates the cost of families for reduced price breakfast and lunch and provides breakfast at no cost for all families statewide in fiscal year 2027. The governor's budget includes continued funding for the Learner Engagement and Attendance Program beginning in fiscal year 27, and also makes a commitment to continue funding what we believe are impactful programming, such as the department's high dosage tutoring program, the dual credit expansion grant program, and the Science of Reading Masterclass. We know this budget marks the start of a process, and we're prepared to work with the legislature to provide you with whatever information that you will need to make informed decisions to ensure that our 508,402 students are prepared for learning, life, and work beyond school. I'm here with Jessica Bernetti, our Chief of Fiscal and Administrative Services, as well as, if you can see behind me, some key members of my team. And so we're happy to answer any questions that you may have. Thank you very much.
Thank you very much, Commissioner. It's a pleasure to see you today. I think that there's a lot of questions. There may not be, but I have a few questions.
You do?
One or two. And I want to start off with special education. It looks like not only with the second year of the biennium, but also in current year, there may be some additional funds that will be given for the excess cost of the special education sort of system. If the legislature approves an additional 40 million in current year, and the tier system remains the same, which is what we have been told, the money would remain the same, but the top tier is only at like 62. Do you know where that 40 million would get to? What would it bring us to relative to a percentage for those tier 1 towns?
So thank you for that, because we've been looking at what that means, and you're exactly right that the tiers are still in legislation. And so if you add to that, as long as it's not fully funded, there's still going to need to have that calculation done. We'll certainly go back and take a look at what that would take us to. I think right now it's about, with the current funding, about 63 cents on the dollar is really where we are. So we have to put in that 40 now and do the calculation to share with you to see where it lands us. But certainly, the uncapped amount right now is about close to $290 million. It's not final yet. So we know that we have those numbers to work with, Senator, but you are correct that that's really where we are. So we can do that and bring it back to you so you can have a sense of where that would take us.
So a lot of people seem to not understand the different components of special education. So a student gets identified as a special education student. They either have it's a number of different ways to come up with the determination on who is what. And then the school starts treating their special education needs and has an idea of what they're spending per child. But the first 4.5 0.49999% is all covered by the local school system and some IDEA and maybe Title I funding. Is that your understanding on how special education excess cost doesn't kick in until the latter end of the 4.5 times?
Until you get to that number, right? For those additional, well, those students with the highest needs, where you have the most cost associated with them. And I'm going to ask Brian Klinkowitz to join me here, special ed director, specifically, because you're correct that we do get the IDEA funding that comes to us and goes directly to districts as well. So they use that, and we can share with you how much we have in that pot of resources. And so that's one way that the funds occur. And you're correct that districts can also utilize additional funds. And oh, by the way, maybe this is a quick plug. You know, the IDEA is now celebrating that law. It's 50 years this year. And when that law came into being, there was a promise of a 40% right support for that. And we've only gotten, this is federally, only about 14 to 16% of that funding federally. So if there's an advocacy right now, I think that there's need for that advocacy federally for stepping in to increase funding to that program as well.
So I have been told that it's more or less around 6% or 7% that we're getting for that delta of special education. Can you let us know, is it different by school? How is that working? Because I'd like to understand how much are we getting in federally? And you've been, you and your office have been kind enough to give us the numbers when I was talking to my local districts, and I know you do the same thing in New Haven and probably for 187 of us. But we are all looking at the numbers saying to the schools, you're getting these dollars, and where do you stand on things? So because I looked at IDEA and the Title I through whatever, the dollars that are getting, so like in Norwich, that's a $3 million, give or take, delta. But I'm wondering what's going to happen should we not get those dollars, because that's going to put all schools at a significant disadvantage. So I'd like to know, where do we stand on what the real percentage is, and does it differ by community?
Thank you. Brian?
Thank you. Good afternoon, Brian Klimkowitz, Special Education Division Director. Thank you for your question, Senator. So the commissioner mentioned the overall percentage that's delineated to states. There is a federal formula for each of our local school districts that's based on census and poverty rates within the district. So that's a federal formula and how they come to those exact dollar amounts that each district has. So we have a breakdown by district for the funds that they receive. And answering your question about the excess cost reimbursement, you're absolutely right about the 4.5 times. So each district has a per pupil cost on what it costs to educate a child. And then 4.5 times above that is where the excess cost reimbursement dollars from the state would kick in to supplement those high cost needs students. So each LEA at right around this time in the spring receives an application for the federal IDA grant. We don't always have the figures when that application is submitted, so we utilize the previous year's numbers as a starting point. And then the districts create their budgets, submit those within our electronic grant management system. We review those. And then once the actual allocation happens, then those dollars are allocated to the districts. And our system now is on a reimbursement system. So as districts are utilizing and spending money and invoices and paying their staff and tuition, they're accessing our system to be reimbursed for those costs.
And we can share with you a list by district, so
yes,
we can make that available to you.
And what the formula is too.
Yes.
Okay, that would be helpful. So I also am looking at the family resource centers, which is really very well, in my opinion, well-run programs. But there's a significant cut in the family resource centers this year, $6 million cut. Is that in an attempt just to cut money, or was there a policy reason behind that?
So I believe the Family Resource Centers, Neighborhood Youth Centers, after-school program, school-based diversion, parent trust, and the LEAP program, separate from, this is not the attendance program, were all rolled into one fund. And I really believe a part of that, Senator, is about administrative efficiency, because all of these are currently now individual programs that districts or entities have to apply for individually. I believe this is an attempt to be more comprehensive in an approach. So an FRC, if it wants to be an FRC and also have an after-school program or parent trust, working for families, that they could apply for one grant through us to do that instead of individual applications in order to do that. So I think it's really more about administrative efficiency, not only on the part of the agency, but also on the part of the entities that would want to get at those resources.
So when I add them all up, or when it is added, I didn't do the addition and subtraction. I could have, but I did not. I'm counting on this being correct, but it says the total will be still a $1.9 million decrease in funding. And do you have any idea sort of how that is going to play out, or is this a new system that we're going to have to get used to if we stay with this?
Right. If we stay with this, I mean, I believe some of this could be borne at the agency level in terms of its administrative efficiency in managing the program.
All right. And EastCon in Eastern Connecticut handles some 40 towns. EastCon had a significant funding problem probably over the last 5 years. And at least over the last 5 years, when the new executive director got there, whatever the title may happen to be, has straightened up a lot of things. Do you have audits that happen at the RESC or the type of systems that EastCon learned those types of systems are? Was there no noticing that they were having an overall problem relative to their financial footing?
Yeah, and I do believe that they're audited along with all our districts, and we take a look at those as they come in. I am not aware that there was any red flags, specifically around that. As you know, we've been trying to work with the executive director as best we can to make sure that we can help support what is occurring. As you know, with the meeting we had with you all, that he was on that call, so we can help to support the work that they're doing in that part of the state. I think it is important, but not to my knowledge that there was like a red flag that there are issues or concerns here. I believe he inherited a situation that he's trying to work through.
I don't think I think he's done a lot of work to kind of straighten things out, but I think that he may need a little bit of financial assistance to get the last little bit over the hurdle. He's changed policies. He's diminished his staff. He has hired people to do the job correctly. So I think that that's something that we should be looking at. Representative Walker.
Thank you. Good afternoon. Great to see you and your staff at IG, Adult Ed forever. Anyhow, I had to leave right when you were finishing up with Senator Austin. We were talking about special ed, and you said that there are multiple funding sources that go to the towns besides IDEA. There was also Title I, did you say?
No, what I was saying is that the title funding, as much as they can also help to utilize that. I know districts also have to be careful about the different rules for all those different programs. But there is a way to be able to utilize some of those funds.
Okay, so the only ones that are supposed to go directly to the districts are our excess funding that we provide to them, which is paid for through the feds, correct?
The
excess,
excess cost is the state
Yep,
funding that goes to them.
Oh, that's
IDEA
only
is a
state funding,
federal,
okay.
right, is a federal funding that goes to them.
okay, so those two do go directly to the towns, correct?
Yes, the
Okay.
portion of the IDEA funds that is for the district, based on a formula that we were just sharing, goes directly to the districts.
Okay, all right. In the big concern is the increase in costs. And I think you and I have talked about this a lot. One, looking at capping costs, which I think is really important for us to look at, because to me, it's an unlicensed industry. And I'm trying to figure out, how do we license this industry? I know that SDE has responsibility for, is it
Approval.
licensing or
Approval.
approval?
Right.
Okay, so it's not licensing, not certification, it's just approval. Can you tell us, what do you look at when you're just doing approval? Because I believe the belief is, or the people out there think that you guys are licensing, they're going through the licensing process, which you're not. So I would like to know, what do you do for the approval part?
So thank you for that. I'm also gonna have Brian, oh, he's already still sitting there.
Oh, he should
Special
stay
Ed
there.
Director.
Don't go anywhere. Would you like some water?
But you're correct that we have an approval process that we go through. We have approval principles and criteria set by the State Board of Education.
Okay.
And so these entities have to submit to us like a 32-page application
Okay.
around governance, administration, fiscal management, admission, how they're going to handle student records, whether they have qualified staff, all of those and more. In terms of student management techniques, are they going to progress monitor? So we have all that, and we can share that with you.
Yeah, would you send that to Susan Keene, please?
Yes.
Because I think we would like to break that down a little bit.
Yeah.
But going through there, so you do the demographics, you do, not the demographics, you do the operational part of the organization,
And then an on-site visit.
and an on-site.
So staff
What do you
go
look for when
out.
you go into an on-site
So
visit?
on-site visit, maybe Brian can jump in with this. They take staff into them.
Sure. There are interviews that are conducted, classroom observations, interviews with the administrators and staff. There's also on-site file reviews. So they're looking in personnel files for background checks, fingerprinting, all the required activities for a school to operate. On our on-site visits, a representative from the State Department of Education attends, as well as a director of another private school setting that isn't from that school, and then a local school district representative as well. So there's a team that goes into that on-site visit.
Okay, so it's 32 pages. It's about, do you get into success? Do they have to prove that, and not necessarily, I don't want to say evidence-based because I think it's stupid, but do they have to prove that they're able to really make an impact, goals on working with the kids, something like that, to say, so that you can see how effective they are?
So the student achievement is not part of the standards process, although we monitor and track each student's achievement. The students that attend there, we monitor through the local education agency. So the resident town is responsible for those students, even though they're attending another program. So there's 3 different levels of accountability when we're talking about student achievement and outcomes, including the parent. So at that local planning and placement team, they're meeting at least annually, if not more often, and receiving quarterly updates. There is a requirement for APSEPs to provide quarterly updates on achievement and progress for students. So when we go, we're looking in those files to ensure that those data are being processed and communicated from the approved privates to the districts through that planning and placement team.
Okay. So, I mean, we use a lot of different things. We evaluate programs, we evaluate colleges, we evaluate schools, we evaluate teachers. We have somewhat of a rubric to use to make those determinations. Do you have some sort of foundation when you when you go in there to evaluate program? I'm going to say my astonishment or whatever is the fact that we don't determine whether they're effective or not. I mean, just the fact that they're there, that's what we determine. But the effectiveness with the children, is not part of the evaluation. So
It's not, yeah, it's not part of our standards approval process because there's logistics involved with ensuring that those schools have the staff, the highly qualified staff that are needed to deliver
you
the
used a word
services.
that you should never use.
What's that?
You said, "we assume." That makes me nervous because we've got to sometimes prove that it happens or it doesn't happen. Because when
Yeah.
we assume, you know what it means.
Right, I
So
didn't mean to use the word,
Okay.
yeah.
that scared me.
Part of our process is that we're checking to ensure that all of the staff are highly qualified to deliver those services. And the students' achievement and progress is the responsibility of the local education agency and the planning and placement team. So as those teams are reviewing student level data for each student that attends, a decision's made. Is this program meeting this child's needs? It may meet one student's needs, but not another student, even in the same classroom. So that's why those planning and placement teams are in place, and the responsibility of the local education agency to say, one, is this IEP being implemented with fidelity at this location? And two, do we need to look for an alternative if that student is struggling and not meeting their individual goals and objectives? That team can determine another placement that would be more successful for that student.
I guess the fact that the districts really are the ones that have to determine the effectiveness for the child is concerning too, because most of the time they hire out or send the kids out for services or whatever, especially when it requires like social development, things like that. And a lot of the school districts are trying to figure out a lot of things, but I don't know whether they all have, I mean, our 169 towns, I'm sure don't have someone that is trained in that area of evaluating a special ed student's achievements the way we need. So then we leave it up to the person who we're hiring to make those determinations, but yet we're not really recording the effectiveness of it. And this is an industry that we talked to CTEC this morning. They went from 1,000 in 2017 to almost 2,000 in the current day, so that it's doubled. And the number of kids that are being put into special ed, I think sometimes the definition of special ed gets utilized in a variety of different ways that do not meet with the requirements for the child. I remember during my day, we called it the soccer mom thing, where we wanted all kids to have untimed tests. So they all somehow got their kids into special ed so that they could get untimed tests. But that didn't necessarily qualify. So I'm seeing a lot more money, a lot more kids defined in it, but I don't see any validation of those types of things. So I think I've made a point, and I'll stop going because I'm a little hard.
It is important, though, that we're having this conversation.
Oh, yeah.
Representative, we have 94,000 students in our state that qualifies as students with disabilities. And that number is growing. We recognize that. And so the conversations that we're also having is, how is the determination made? If there is student needs more tier 1 services in a classroom for either behavior or, let's say, literacy, doesn't necessarily mean that that is a child that should be getting special education services. So that is work that we're actually doing right now, across the agency to work with our districts in that vein. So that is really important, that as we talk about this, that we are providing, but those supports are also necessary in the districts, in the classrooms, to support our students. I think we also have access, Brian, to the IEP of all the students.
Yes, we do. Yeah, each student is in our
I'm not gonna monopolize, but I'm gonna ask a couple more questions that are very direct. First of all, how many staff members do you have now in SDE?
In SDE.
I would say how many are authorized and how many are paid for?
So right now we have 284 authorized. However, based on our budget, we're probably funded to have 175.
Okay, in your 175, how many staff do you have dedicated to special ed?
Special education.
So we have a number of staff that like through different departments as well. So for example, in our performance office, there are several staff. Within the Bureau of Special Education specifically, there are 20.
20.
Yeah.
So you have 20 people that have to work with 169 towns and private schools, et cetera. They're also evaluating IEPs. They're also working with the districts to help them understand how they're doing their special ed things. I guess 20 people costs about how much? Just give me a round idea. About $1 million?
Yeah.
We estimate about 100,000 per position.
Okay,
Yeah.
so you do the math.
Yeah.
I got it. Yeah, 3 million. Um, so I think in my statement and probably going forward with this budget, I think it's very important that we give you the funding to have a robust special ed department to help us design and go forth and train school districts in special ed, because at the rate of the cost that we are getting, it's astronomical. And if we don't put the money in, we will be doing this for years and years, and we will say, well, why didn't we do this? And what? I think this is a time where we really build out a special ed section of SDE that is dedicated to help our districts survive this. This is a tsunami in the sense that it's like we have an unknown entity. It's called special ed, and it's unknown how much I can charge you. So that means I can have a tap line to everybody's purse whenever I want it. And I'm not saying that I'm not discrediting people, but there are things that happen where we're charging people for things that don't necessarily help our kids. So I think we need to take control of that. And I think that's really, really important that we start it now, especially when I have colleagues that think we can just dump $40 million into a line and that's going to save the world. But I didn't say that. So anyhow, thank you, ma'am.
May I just add, as really great line of questioning on your comments, and that is why, so there's the excess cost that you just talked about, but that's why we're looking at rate setting. In another month or so that we will be able to share with you, we're finalizing the study that we're doing. And I know sometimes study comes with a bad word because you study things forever and never do anything about it.
I only say that once in a while.
That is not what we're doing here. And so we're looking at under the work we're doing with our research collaborative, we're looking at the other states around who've already set rates. We're learning, hearing from them. We're talking to superintendents. So we will have a good sense of how we need to be doing this. And so there's a legislative proposal about the department being able to set rates.
Okay.
And then, so there's one piece of it, right? There's excess cost, but it's not about just giving us money forever. We're going to talk about rate setting that helps to have more predictability. There's also a proposal that connected to that. So there's rate setting, but there's also
Quality assurance.
Yes, yeah, well, that would be a
Could
part
we
of.
could we put
could be
that in?
part of that as well. But no, the in-district programs, right? So that we'll be funding, if the budget gets approved the way it is, or when you all get done negotiating, that we will be able to, districts will be able to work together to build their own in-district programs, right? That will also reduce the reliance in out-of-district placement, which has its place in terms of the needs of students, but they'll be able to do some more building of their own program in the local district.
You're music to my ears. Thank you very much. Thank you, Madam Chair.
Representative Walker asked, does the funding go directly for IDEA to the districts? But you are a pass-through entity, right? You still, the money goes to you.
Yes.
Do you then do the formula and then send it out? Do you keep a portion for administrative works? Is that what happens?
Yes, and it's determined how much we can keep for administrative
Yep.
amounts. That's a part of it as well. So yes, there is administrative amounts that we keep,
Yep.
and then the others through the formula through us gets out to the district. I have to tell you, this past year, because there was a reduction to our districts in the formula, the federal formula, and we took $1 million extra that came in for our set aside for administration, and we passed it out directly to our districts as well.
Thank
it is
you.
important work.
Just please make sure you send your evaluation sheet, the packet, whatever it is, to Sukeen so that we could all, and any other documentation that goes along with it when you go evaluate a program. We'd like to see that and study that. Thank you.
Senator McCrory.
Good afternoon, Commissioner. How you doing?
Well, thank you.
Good to see your team. I'm gonna try to keep my questions strictly on budget here. We talk about policy. I know. We talk policy all day long. I'm just trying to keep a couple questions towards money. On page 4, I'm looking. I think I heard my colleagues speak about this, but I came in late. I was busy in another meeting. The consolidation of all these programs, LEAP, Connecticut Alliance Boys and Girls Club, and so on and so forth. And from my understanding, it's a $1.9 million reduction. Is that correct?
Yes, it is.
So my concern about making this to a competitive grant program, each one of these organizations here listed do separate things. They do specific things. After school programming is after school program. Family resources has been around for a number of years. They do something totally different from what school-based diversionary programs and all this. Why did you guys decide to make this a competitive grant program when we need each one of these organizations to continue to do the things that they're doing? And why did we reduce the budget?
The funding, as you mentioned, Senator, the programs didn't go away, right? So they're all in this one funding source. And I do believe, as I mentioned before, that there's an opportunity here if this passes for us to think about some administrative efficiencies in that program. Right now, you mentioned after-school program. We have a staff person dedicated to the after-school program. They run a separate RFP. Folks go through a competitive process. FRC has another staff person with all that, a separate application.
A staff person working with you all?
Yes, yes. We're talking about our administrator, for those, may not be full-time, 100%. But running that because we have competitive applications that we put out RFPs that go out that the entire, community can apply for. And so we have hundreds of applications come in that they've got to be read and scored and all of that. Just talk about the after-school program, right? So there is a process for that to happen. As I mentioned before, there may be some administrative efficiencies that can be had. And if you're out there to say, I'm an entity and I want to run FRC, you know what? I also want to add an after-school component to this work. And oh, by the way, I want to do a program for families. That's a part of this as well. If all of that is together, an entity may be able to apply for all of those, a very comprehensive plan that they put together. That's a different way of looking at how we're able to do this work and braid and blend funds for more efficiency, not only for the agency, but more so for the districts and those entities that could be applying for a program. Yes, right now, that is how we see them. There are times, Senator, that we may have to think a little bit differently about how we do our program structure for efficiency and for maximum impact and service to the community.
I understand. And I'm all about efficiency and doing things differently the way we do it. I'm just not comfortable with the fact that some of these entities specialize in specific areas. I hear what you're saying, but I'm just a little uncomfortable with making them all go after a competitive grant process. And if you're telling me that you can save 10%, you can find 10%, which is about $1.9 million in efficiencies by combining these programs, then your math is really good. I need you on a whole lot of other budgets and things of that nature. I'm not, that doesn't jive with me. I'll just inform you that. Oh, I thought it was supposed to be reduced by, oh yeah, right. Overall, yeah, you reduce the total amount by 3.8 million. That doesn't work. We'll talk about it in the budgetary discussion, but that's not gonna work. All right, also, I'm concerned about these, the COVID-19 programs. You're doing a lot of work in 2027, but you're not doing anything in 2026. There's a gap. Funding for your dual credit program, funding for your LEAP program, your own LEAP program, great program. We announced that great guys doing great things, right? But there's no funding in 2026.
That is certainly the conversation I'm sure that you all are going to have in negotiating the budget.
Well, why you want me to negotiate? You should have put some money in there in the first place.
But you should also know the LEAP program, which you're exactly right, was funded for ARPA, and that funding is available through December of 2026. right? So that funding is there to continue to do that work. So I think that was a part of the decision point in terms of when the funding kicks in 27.
So you saying you do have enough money for the LEAP program for 2026 using ARPA money?
You're talking about the learner engagement and attendance program. Let's be sure. Is that what you're talking about?
Yeah, that's LEAP.
So yes, so the ARPA funding goes through the end of December 2026. That's the funding we're currently using right now for that.
Okay, but you don't have money for the dual credit program.
It's same for dual credit.
Okay. Same for dual credit?
Right. ARPA funding for those as well.
But that's not listed. That's not spelled out here. That's not explained here for 2026. It says it's blank for 2026. There's no communication.
That's right, because that's the state funding, right? The budget is your state funds.
For the 26, doesn't have it for 27.
Right.
Okay. All right.
Continuing to 2027.
So this is supposed to be 26.
They don't have the
Right.
ARPA dollars in there because the ARPA dollars were last year and they wouldn't be in the budget. So
Okay,
the
all
ARPA
right.
dollars are still sitting there, but we should ask the question for them to bring to the work group for us to see that there are enough ARPA dollars to do all of those. That
Okay,
would be
let's do-
probably the best
Okay,
question.
that's a good way of framing that. Just bring me or working group, bring how you're gonna show me in numbers that you have the money for 2026 to do these programs.
Janelle,
'Cause I
over
want
there
that.
shaking your head. Yes, that's what you.
You got it? Okay, all right, Janelle. I trust Janelle. Janelle's fine. I'm gonna go to the school meal program. As an educator, been in the system for 33 years. I'm all for free breakfast and free lunch. But I'll tell you this, and I don't know if you have your hands on this, and this is time where we should have this conversation because we're gonna put $13 million into this program. The foods are horrible in our school system. I don't know about your school district, but the ones that I work in, the food is horrible. So unless we're gonna do something about providing better quality of options for our children, I'm not inclined to put $13 million in something that I know children throw away every single day. Every single day, I watch lunch and breakfast, the majority of thrown in the trash can, wasted. And I know we want to do well for children and families that need this support, but when I see that waste, that troubles me. And I know it doesn't have to be that way because I visited other school districts where the options are outstanding and the kids are gravitating towards them. So we got to have a conversation about quality when we talk about spending. I am very concerned about this. I am not interested in putting $13 million out there when I know $12 million of it will be in the trash can. That's a fact, and that's a truth. That's real live activity. You can talk to any educator that works in the public school system. They'll tell you that's going on in many school districts. Not all of them, but you can imagine which ones they are. So you don't have to respond, but when we come to the working group, have that mindset when we talk about how we're going to make this better. I don't mind spending the money, but I want to make it better. On page the choice program, I'm gonna come back to that. Oh, the aspiring, I like you guys, governor came out about the want to create opportunities for more males to come to education. I like that idea. I really do. And I have a plan not only to increase that, but also continue to work on that, what we've been doing the last 10 years. My question is, and what I've been finding out, you always take the opportunity to champion the fact that what we have done over the last 5 years in increasing the diversity in our schools, you have been championing it and we've been doing it. But when you pull the covers back, there's certain programs that have been doing it better than others, right? So we got programs out there like TRP, and I'm proud of it, that are creating more and more teachers of color throughout the state. I need to make sure they have the resources they need to continue that program, because they're the ones that's doing it. They're producing more teachers of color in this state of Canada than all our colleges and universities combined, and have been doing that for the last 5 years. So we need to put resources into those programs and expand them. And one of the things we're going to do is expand them through all school districts throughout the state of Connecticut, because it works. So during the working group, let's have a conversation about expanding this program and expanding opportunities to continue to diversify our teacher program. I have some ideas along with your ideas so we can put this together. So I say that to say, when your reduction of the $6 million in the scholarship program, that's not going to work, because we're going to use those $6 million to do what I just said about continuing to provide quality, diverse educating process. So the idea of us taking $6 million back in 2026 and $6 million that in 27 for Aspire Education Program, that's not going to operationalize with me. It's not going to work. So have that in mind when we have the conversations, when we have our working group. And lastly, there's a limit. Let's talk about these programs. As you're eliminating $4.8 million in your for various groups programs. I need to talk a little more about that and why we're looking to do that. Are we doing it just to save money, or is it something that's not working policy wise? I want to explore why we're just unilaterally just taking out programs that have been working effectively in our community. Lastly, and because I don't want to dominate this conversation, the Dalio Foundation and the Disconnected Youth. They came before us. They made a great presentation. They have a huge ask. When I say ask, as far as a dollar wise, have you guys been supportive of what they? I want to just talk about that from a educational perspective, because what their concerns is disconnected youth start from 14 and go to 26. But for the kids, the age group that are still in our public school system, have you guys evaluated what the organization, the Dalio Foundation, have done around disconnected youth, and how would that be supportive? Are you supportive of some of the things they're asking school districts to do in regards to helping disconnected youth?
So great question, and we've met with them to talk about what they're finding and where we are. As you know, the numbers went down in the most recent report, and a big part of that is because we have more students attending schools regularly. So our initiatives around attendance is actually making a difference. We've talked about just some of the initiatives that we're also doing and working with them. But any effort to engage our students is something that we're certainly all supportive of. And so we've had those conversations, and we'll continue to have those conversations as we move forward together. And that's what we've talked about, is how do we work together to ensure that what they're seeing or what they're recommending dovetails with some of the work that we're currently doing and what we're also investing in.
Okay. I like that answer, because as a policy, as a policymaker, as an educated policymaker, policy-wise, I agree with everything. I'm gonna agree with everything they say. I'm probably gonna support it all, but I'm gonna send the money over to you guys to see if you gonna find the money for it. Policy-wise, it makes sense. Financially, you have to figure it out. Yeah. So yeah, that's all I have for you. We talk often, and we'll continue to work around these dollar issues. But that's all the questions I have. Thank you very much.
Thank you.
Representative Leeper.
Thank you, Madam Chair. Hi, Commissioner. Nice to see you. 2 days in a row.
Yes.
So I have a few questions, and I'm so glad to see you back today, since I didn't get to ask these about the governor's budget yesterday. I noticed that in the governor's budget, he has said that the ECS increases must go to 3 specific areas. So chronic absenteeism, student disengagement, or academic recovery. Am I understanding that requirement correctly?
That's correct. For any increases, I think is the way it is written, I believe.
So if a student is experiencing an increase in population and receiving more ECS funds, those dollars have to only be allocated to these 3 areas?
Must include that was how I interpret that, the work that must be done. I don't have that legislation in front of me, but I think that's the way it is written.
Okay, that's helpful. Thank you. And I guess I would just say a point that has already been raised. One of the 3 primary focuses for the governor is student disengagement, while simultaneously collapsing and reducing the 6 items that are really focused on student engagement, both from a prevention standpoint and a re-engagement standpoint. And I worry a lot about the idea that these programs are going to be competitively bid. For example, we could have the Boys and Girls Club of Hartford competing against the Boys and Girls Club of Newington. And without reliable funding year to year, it makes strategic investments in programming continuity really difficult for these programs. You don't have to comment on that unless you'd like to, but I just wanted to share our concern about that.
I think what will be helpful at the work session, we will bring to you the list of how the existing programs and what they look like, because after school is competitive. And there's always usually not enough funds to fund everyone in that space that asks for that. So why don't I share with you all then kind of the breakdown for all of these programs and what that looks like.
That'd be great.
Because the point is, because right now, even standalone after school, it is competitive, right? So folks are competing for that funding.
All right. So we've reduced almost $2 million from what's available from something that's already stretched pretty thin. So I think that's concerning when we've made disconnected youth a real priority and focus for the state. But I would look forward to discussing it further. Also around the ways in which we're funding our choice programs, and particularly for our magnets, this budget removes the tuition caps and also allows for tuition to expand based on CPI year over year. So that's a cost that's going back onto the sending district. Is the sending district going to be receiving any CPI increases for the foundation ECS amount to help them bear that shift?
I will ask my colleagues, is Robin here just to talk about? She's my choice program, magnet program czar.
Perfect.
Hi, I'm Robin Cecier, Division Director for School Choice. The way the legislation reads is that that's the accelerator. So through 2027, the cap remains at that 58% from fiscal year 24. So it's kind of flat for those years. And then thereafter, it allows for that multiplier still at that 58%, but recognizing some cost of living adjustment relative to the tuition. So yes, that would move with the charge to go back to the sending district, but it's intended to reflect cost of living without being discretionary relative to the operator. It's tagged to something that reflects that cost of living.
That's helpful. And we're holding our magnet schools flat in terms of funding so they can increase on the tuition side, and we have not allocated additional funds for them on the grant side.
So there is no accelerator on the grant side, correct? It continues in that new framework, which does add additional funding, has added additional funding across the system for magnet operators, so that at least they're getting what they received in fiscal year 24. But for all of the operators, there was a significant increase. But yes, going forward to this point, the way it's reading, there is no built-in accelerator.
So the magnets exist because we've told them they had to, right? From a statutory standpoint, and really from a judicial standpoint, right? They have been forced to exist. They have no tax base to draw from. So by both capping how much we allocate to them and how much they can get from tuition, they're sort of handcuffed. How are they to continue to help those students thrive? And I will just say, Senator McCrory and I heard yesterday from several of those students about what an exceptional education they're receiving at their Craig magnet schools. And we're hearing simultaneously from our magnet operators, they have a lot of unmet needs, even just in terms of facilities, never mind contractual obligations, right, with their staff. So from a legislative standpoint, my understanding is we are trying to actually move completely away from tuition to fund the magnets so that they don't continue to essentially bankrupt our district that has been sort of not by any choice of their own, also caught up in this arrangement. And so I just wanted to raise that as a concern, because I think we're failing to meet the moment here for our kids who need it the most. And we will continue to discuss this, but I just wanted to raise it as an issue, a very serious concern for me. Again, no response really necessary unless you'd like to. Last thing, I just wanted to clarify, if the high dosage tutoring that we've been offering for the past 3 or 4 years and has been a very successful program. I see here it is a matching program. Has it been a matching program all along? That's a new element.
Yes.
Okay. And is it a 50-50 match?
Well, we've not determined yet what the match would be. If passed, we certainly would be looking at it. This gives us an opportunity to think of all our districts, maybe a little bit differently, in terms of what folks are able to do, considering what they currently have available for them. But no, this is a new element of the program. It was funded through our COVID relief fund. So this would be the first time. And we have evidence, one of the things I made a commitment to is not just to come and ask you for resources, but we're asking you for resources because we have evidence of the effectiveness of the programs. And so we did our testing of doing this work with COVID relief funds, and now it would be in the budget. And so that's how it is listed there.
Thank you. One last question about the cuts to adult ed. Could you just speak a little more to why?
Are you looking at?
Sorry, let me find the page.
On page 5.
Thank you, Senator.
Hi, I'm Jessica Brunetti. I'm the Chief of Fiscal Administrative Services for SDE. I'm just making sure you're talking about the reduction to the fiscal year 25 levels. Is that what you're looking at for the adult ed?
Mm-hmm.
At the bottom. Reduction in 1.7 adult ed, and the reduction of 2.8 in health and wellness.
It's just taking it back to the cap.
Yeah.
Yeah, so it's bringing it back to the capped amount of fiscal year 25. So the money actually was added to the budget and then removed.
Yeah.
Yes.
Yeah, but that's what it is.
What's the justification behind the cap?
I heard you up there.
Okay, appreciate that. So just a last remark, and I'm grateful for the extended time here, is that, everything we don't fund from what we believe is required for our young people to be successful and thriving, and I know we all share that goal, is really just pushing the burden back onto property taxes and requiring our communities to shoulder that. And we know very well in the state that some communities have more ability to shoulder those expenses than others, and that's not our kids' fault. Right. And so I just carry that lens as we pursue and continue these conversations. So thank you very much, Commissioner. Thank you, Senator.
Thank you.
Representative Felipe.
Thank you,
Followed by
Madam Chair.
Representative Exum.
And I'm going to bring up the topic that I think I've brought up for the last 4 years, which is staffing. Right. When I was chair of the subcommittee, we added, I think, a couple hundred positions. Shout out to OPM for never hiring any of them. But in terms of Bridgeport, I know that there is a special attention to our district now from State Department of Education, State Board of Education. And while I think that that's a good thing, I do think that, and I'm going to steal this line because Representative Porter isn't here anymore, people closest to the problems are closest to the solutions. And while you guys are looking at numbers and you definitely talk to the district, is there some type of appetite from you to have maybe positions hired to have people on the ground in Bridgeport, looking at the district, being a part of the district, finding the acute causes of what's happening in our district as you figure things out?
So thank you, Representative, and our commitment to support in Bridgeport. Just today, I don't know if you've seen, there's a press release I put out. I have a technical assistance team that I've put together that will be on ground, that will be there in the district. As you may know, I have the State Education Resource Center in there right now doing listening sessions, talking to students, talking to administrators, and we'll also be talking to members of the community. And I will be in some of those meetings because I think it's important. It's not about them without them. And so we will be there. But the team, we're having an entrance conference with the districts next week. The team is now assembled to be there to support the district.
And just generally, how often do you think that those folks will be in the district?
And I think it will vary depending on what it is that they're zeroing in on. We have expertise in special education, in facilities, in budgeting and all of that. So I think it will determine that the time in district will be determined by what it is that they're actually looking at and their access to resources. There's a lot of information and data that we also have at the agency that we'll be sharing with them. So they won't be starting from zero, right? They'll be having information to share that they'll be able to share.
Thank you, and I appreciate that answer. I think it's really important that the intervention is there. But I hope that we don't get to this level, and I know people have been using the word takeover. I like the fact that you're getting involved. I like the fact that you're learning, but I do think there needs to be a Bridgeport perspective in that, and I'm glad that you're taking that interest. Thank you, Madam Chair.
We want to make sure, Representative, that the district is set up for success. It is not about let's go in and try to do something and then walk away and then it falls apart. We would not have achieved anything if that occurs. So it's also supporting the district. So when they get to a point of getting leadership or permanent leadership in place, that we don't just walk away, that we're there to help onboard and support them as well. So we're in it to make sure that that takes place.
All set, Representative? So I just want to pick off of what Representative Felipe is saying when you're bringing back data to talk about Bridgeport. The formula talks about a section that talks about property, wealth, and income for that particular town. Now, Bridgeport doesn't have the pilot funding that other towns, large towns like them have, like Hartford and New Haven, for example. And if you looked at the number of children in Bridgeport and the number of children in Hartford and New Haven, Bridgeport has more children. And so I think the numbers get skewed by their property, wealth, and income that is in the Black Rock section of Bridgeport without any understanding of what's going on. So I appreciate Representative Felipe pointing out that there should be a Bridgeport component of it. But we have been talking about Bridgeport's components for a long time. And we have never looked at the differences in the funding that they receive comparative to similar towns and cities of that size and not tried to figure out what the difference is. And if you have more money going to New Haven and Hartford based on their property and income wealth without understanding that there is a real skewing of information in Bridgeport, I think is a mistake for all of us. That seems to me to be something that we should be paying attention to, because just the number of children there, the socioeconomic status of the number of residents that live in Bridgeport itself, it shows that we are, we can all say we've given them too much money, that they're not doing things right, and we can all criticize Bridgeport, but in my opinion, from somebody who does not live in Bridgeport, can't live any farther away than most other people, I think that we're not doing them any justice by not paying attention to the demographics that are in Bridgeport, not providing them with the resources that they need. So I think that that's something that we have to really pay attention to, and not just avoid the real question, what is the difference between the other towns of similar sizes? So that's what I would like to see you come back with that component.
And Senator, it's so important because I believe it's a both and, as you're looking at that from the perspective of funding, but we're also ensuring that the funding that is there is maximized.
Correct.
I think it is important, right? Because
but you can't maximize funding when you don't have enough to begin with. If you are so significantly decreasing, everybody says we shouldn't give any more money to Bridgeport. I hear it all the time. I hear it in my district because I have a rural area. And people say, we'd like to see more money coming here. I'm telling you that Bridgeport does not receive the funding it deserves or needs to deal with the economic status of that. They should have maximization in funding. Absolutely. They should have the school systems that they can keep track of. They should have schools that aren't in such bad condition that kids have to wear their coats in classrooms. These are all things that we all know about, but there has to be a reason why we're not getting the funding down there to achieve what has been achievable in New Haven and Hartford relative to the funding. I just ask that we look at what are the differences between those communities and tell me why they deserve far less than the other big cities. I think that's something we should look at. So, Representative Exum.
Thank you so much.
No,
Good to see you, Commissioner. Good to see
you as well.
everyone. I just have a couple questions, but one statement, just echoing what I think is incredibly important, which is these programs that are all being combined and having that grant. I know Senator McCrory spoke on that, and Representative Leeper. I've been inside, I've seen so many of these programs and how effective they are. And I think it's one of those things where we have opportunities to correct or address issues that we're seeing downstream really early on, and especially during the time in which we're dealing with, disengagement in the way that we are. The family resource centers, for instance, I can't imagine having them competitively bid against each other. They serve such an important role in the communities. And then looking at our after school programs, the Parent Trust Fund, I know through that's the Parent Leadership Training Institute, and what that really can do for families. So I was very concerned about the fact that it was lumped together and the competitive piece. So I would really like to look at other ways. I just feel like for the amount of money, we get a lot of bang for our buck. And that's one area I'd really like to see reassessed. My question is around, you probably not surprised, around behavioral health. So I'd like to know where in the budget, like what we have for the needs of our students around behavioral health services, what it will look like. I can't really tell how it breaks down the budget. The only thing I can see is that primary mental health, and I know there's a lot more to it than that. So if I could get some more information.
So, no, thank you very much. And John Frasinelli, who oversees the program, will share with us kind of where we are with with ARPA dollars, which is what we've put a lot of investments in. You're correct that primary mental health program is one that we've had for a long time,
right,
in our agency. John?
So thank you, Commissioner, and thank you, Representative, for the question. So we still have the balance of the $28 million that was appropriated in fiscal 23 from the ARPA fund. So as the Commissioner mentioned, that those funds are still in play until December of 2026. So those funds are currently supporting social workers in 20 districts. In one of the grant programs that had $5 million, they were able to hire 20 social workers. The other grant program called the Mental Health Specialist Grant, that went to 73 districts. So they hired social workers and school psychologists as well. So those positions, in addition to the funding that went out for summer programs to bridge between school years, there's another $6.5 million out there. So again, that is going to continue to support those positions through the end of December 2026.
And then and then it all goes away as proposed right now. Can you tell me this? Do you know how effective or how much utilization, what have you seen? Or if you could bring that with you later, I'd love to know when you had that money and you had those resources, and I'm assuming there's more than just staff, that there are other things put into place. What was the impact? Was there a measurable impact by that? I would be interested in knowing that.
Yeah, we have three separate reports, one on each of those programs, and we actually have testimonials from the districts on the impact.
Okay.
From them.
I think that'd be really great to know, so that when we're looking at what we budget for moving forward, the kids' mental health, I mean, it's really hard to learn if you have issues around behavioral health. We all know that. And so the other, and kind of related to that, and I know we're talking a lot about excess cost, and we're talking a lot about outplacement. When looking specifically at schools that are like therapeutic boarding schools, they may be day schools that we have throughout the state. I know a very small, select number of kids usually go there, very expensive. I'm really curious to know about the oversight for that, aside from the expenditure, the oversight piece of that. Like, how many students would that be? How much do you look at the programming, and how do you evaluate its effectiveness? And I know the names of some, I don't want to call them out here. Really curious about that piece. And if that is your purview, I think it is, but if it isn't, how would I look to get more information on that?
So we will certainly come back with you on those to the extent that they are also approved private special education programs. We do, if they're just regular, like private schools, necessarily we wouldn't have oversight, but we'll take a look to see what we have to share with you.
Very good. Thank you. Yeah, I've always been kind of curious about those. They're kind of out there on the fringes a bit. But thank you so much. I just had those major concerns outside of other comments made today, but would look forward to learning more when we all have the working time together. Thank you.
Thank you, Representative McCrory.
Thank you. Who you call?
I'm sorry, I called you a representative. I don't know. I've been too many representatives. I'm got stuck in the wrong chamber. Senator McCrory.
No, Commissioner and your team, I just wanted to piggyback on, I forgot to mention this in my other comments, what my co-chair was mentioning in regards to the choice programs. You know, it was always opposition to stop the tuition payment costs for my sending districts to these magnet schools. Just like my colleague said, the state created these magnet schools because we didn't do what we were supposed to do, right? And it creates too much competition in the chef region among Sydney schools and the magnet schools. When Sydney schools feel that they're losing their students, and that's true, that's real, but also they have to pay, right? So it was always my goal and my intention when we did this this budget the last couple of years to get to a point where we do not have, the districts should not be paying tuition for a program that was created by the state, because the state has not handled its business around desegregating Connecticut. So I think when we have these budgetary conversations, once again, and for the governor to hear and everyone else, I am inclined to getting this to a position where sending school districts should not be paying tuition for students that leave their school districts. I am very adamant about that. I know we're at 58%. That's not enough. It's not those local school districts' responsibility or problem they created because they live in a certain area. So I want to really try to drive this point across as we move forward when we create these budgets about ECS and things of that nature. The tuition is a problem. It's a problem. It creates competition, unhealthy competition that's not working for communities that have to spend money on children they're not educated. So I just want to remind you of that. So we're going to have that conversation going forward. And lastly, what was the last thing you mentioned about? You wanted to say something about
ARPA. Do you want me to say it?
the opera money? In regards to opera, you mentioned that you have resources to cover 2026 for the LEAP program using opera dollars. Do you have any more opera dollars that you still have available? How much money do you still have in opera? Do you have in your agency to maybe cover some other costs of programming that we can make sure we don't lose in 2026 budget?
Yeah, so we will certainly take a look and bring you an updated listing of everything that we have.
That's fair. Thank you.
I'll just add quickly too that the ARPA dollars are all committed to programs. So we don't have uncommitted money. It's just yet to be spent.
So can you tell me what programs they can make so when we have a budget?
Yeah, we'll bring that, but I just
Okay,
wanted to
good.
say we didn't have uncommitted funding.
Thank you.
Representative Corpus. I put her in the right chamber. No promotion for me today. I had a question about, for a change, kind of a non-money question. I had, you all sent me, and I thank you, the numbers for my district, and I was very surprised to see chronic absenteeism at around 20% in both of my towns. And is there any, I saw the programs we have to deal with that, like people going to the kids' houses and stuff, but are there any non-monetary ways that other states have dealt with that? Because if the kids are not there attending the programs that we're funding, we can't be as effective, obviously.
A great question. And chronic absenteeism is something that we've been working on here in Connecticut for over a decade, believe it or not, even prior to the pandemic. And so the LEAP program was a new program that we initiated coming out of with the pandemic. It was so dire that we were doing something different. But districts are doing really a plethora of other kinds of things just to improve engagement and to find out what's happening in it, to establish relationships as well, because the LEAP funding only goes to about 25 districts. so they don't have, that particular resource, but they're using some of the same interventions and strategies, even locally, in order to do that. And so we have a system, it's called First Tuesdays or Tuesdays, Talk Tuesdays. Thank you, Johnson, in there. Talk Tuesdays, where districts come together and they're literally sharing their strategies and outcomes in this space. So there's several things that's actually happening outside of the LEAP program in order to address this issue, because it is one, Representative, you're correct. We cannot educate empty seats. And so if our students are not there, no matter how brilliant the teacher and everything else that we're doing, we won't get to the outcomes that we need for our students. So that is something that we've paid very close attention to. John, I don't know if you have any other information to add about that.
I mean, just to say that some of those initiatives include making sure the curriculum is engaging, right? Making sure that students have opportunities for advanced placement courses, making sure that there's a connection with families so that families understand the importance of coming to school. All of those things are just making sure that families are connected to school and understand the importance of coming to school. Transportation policies sometimes impact student attendance during inclement weather and things like that. So there are a number of non-budgetary supports that encourage folks to send their kids to school.
I can also add, Representative, that one of the in the budget, you'll see high dosage tutoring, where students have tutors that work directly with them. I know one district, having visited the district, said not only were students' math outcomes improving, but attendance was also improving, because they're developing relationship with a tutor that's looking out for them, asking after them if they're not in school. And so those relationships matter. So those are some other things that I know that we've worked on, and I think just allows, make place for more connection, students being in school.
Thank you.
Senator, thank you.
So I'm going to wrap it up with a few rapid fire questions. I think you said to Representative Leeper something about the increase in, I thought ECS funding was tied directly to making changes in 3 specific areas. Is that it, or is ECS, because ECS is already bound by so many things, is that something that is being done, recommended in this budget?
There is a legislative proposal, and we'll make sure we get that to you, that addresses any increases that should be dedicated to doing some of
We
that.
already dedicated on alliance districts, and in some towns, they find that to be very difficult for them, especially if they're only a K through 8 or pre-K to 8, and they have to pay for high school. So that's something that I would probably be opposed to unless I figure out how we're going to get funding to people. I don't, that's a problem from my perspective, in particular when we're going to have salary increases and other things. On the hold harmless towns, which happen to be all small communities, I'm absolutely opposed to not holding those towns harmless. When you're causing a full mill increase in some of these towns to cover this, and the number of students that are decreased are maybe 1 or 2 per grade level, they can't get rid of a whole grade. They can't do that. They're not seeing a decrease in cost. So I think that is not something that people understand relative to rural communities. And so that's something that I am opposed today. I'll be opposed tomorrow. I'll be opposed to a budget that does not fairly treat rural communities in the funding that they're getting. And can you get for us you added 5 new charter schools were approved, so now we're up to 7. Can you get us the cost of implementing those 7 charter schools? Bring that to us, to send that to us, because we all know that, some of your charter schools, you've trotted them out to these schools are doing really great work. These are top-rated schools. Stanford School of Excellence is a charter school, something that we all love. IDCS was brought up, bringing all their kids back. They're doing great work. So I'd like to understand where that is, and I don't see it in the budget. Do you have those numbers in the budget for those?
The new schools are not in the budget.
Okay. So, I mean, either we have to stop having them come before you, or we have to start getting them funded, because this is just becoming increasingly difficult. And if we're not gonna, if we require them to do all the work, we should actually fund them because they've done all the work. They're approved by their communities. It's getting to be a little ridiculous. And the charter school, I sent to your chief of staff. We talked a little bit on the school construction grants for charter schools. If you could bring that information to us too, on where we stand and how we're going to do that.
We certainly will. In 2 weeks, the RFPs will be out.
Thank you very much. I appreciate that. And anybody have anything else last minute or beyond our time frame? Thank you very much for extending your time with us. Have a nice day.
Thank you.
We're ending our agency public hearing. We'll be back at 3 o'clock to start our 226, is it? 200. 64. Jeez Louise, it's 13 hours of hearings tonight. So as with everything else, we're gonna split up the time frames with people, so just be prepared for people to step in. We'll see you all soon, and we'll be on a different Zoom link when we come back. Thank you. What is it? Corpus? Corpus. Yes, I said it right? I said, okay.
I didn't promote you to senator.
I didn't. I demoted, Doug, but.
Yeah, so tell me about you. Okay. Barely keeping up with this. I mean, this is Oh, wow. And then that's certainly one of the. How old was he? Yeah. And he's 19. And he was at